Bruce, you must have something really good too.
Of course I do. It's Bruce Danielson, and I guess I'm here to entertain you too.
We'll go ahead and get started tonight by reading our roll, please.
Council members Jensen,
Here.
Kiley,
Here.
Neitzert,
Here.
Selberg,
Here.
Sale,
Here.
Starr,
Here.
Brecky, here, Erickson.
Here.
All right, to give our invocation tonight was supposed to be Pastor Dave Thompson with Empire Baptist, and he is ill. So under the other duties as assigned, I'm going to give the invocation. So I'd ask that you rise for that, and then we'll stay standing for our Pledge of Allegiance. Dear Lord, we thank you for this time tonight that we can gather and conduct the business of our city. Lord, we ask that you be with this body and the issues in front of us. Lord, they're not easy, and it's a hard time to lead. It's a hard time to serve on this council, and I thank you for these counselors, the time they put into this work, the effort they put into this work. It's thankless work for them, and I'm honored to serve with them. And I just ask, whatever the decisions tonight, Lord, that we remain unified as a community, unified as a city, unified as a body, so that we can continue to do the work that you have called us to do in this community. In Jesus' name we pray. Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, we'll go ahead and get started with item 4, which is our consent agenda, and any changes or motions to that, council.
Move approval. Second, Jensen.
All right, motion by Selberg, seconded by Jensen. Councilor Brecky.
I move to amend the agenda by placing item number 18 immediately before item 16.
And that will be the regular agenda. We're still on the consent agenda here.
Oh, okay, no, I was going to do that for the regular agenda.
Okay.
Sorry.
Any other discussion on the consent agenda? All right, hearing none, let's take a vote on that, please.
Councilors Jensen,
Yes.
Kiley,
Yes.
Neitzert,
Yes.
Selberg,
Yes.
Sale,
Yes.
Starr,
Yes.
Brecky,
Yes.
Erickson.
Yes.
All right, that passes 8-0. Now we'll move on to our regular agenda, and we'll get a motion on that.
Move to approve.
Second. All right, motion by Brecky, seconded by Sale. Councilor Brecky, go ahead.
Now I'd make a motion to place item 18 immediately before item 16.
Second. All right, motion by Brecky to move that one item, seconded by Councilor Sale. Any discussion on that amendment?
They go together, and one was filed after the regular agenda deadline, so it went to the very end, and it will just make it a more cohesive discussion if we can just discuss them side by side.
Got it. Thank you, Councilor. All right, we'll take a vote on that, please.
Councilors Jensen,
Yes.
Kiley,
Yes.
Neitzert,
Yes.
Selberg,
Yes.
Sale,
Yes.
Starr,
Yes.
Brecky,
Yes.
Erickson.
Yes.
All right, that amendment passes. Any other changes or amendments on the main amended motion now? All right, hearing none, let's take a vote on that, please.
Councilors Jensen,
Yes.
Kiley,
Yes.
Neitzert,
Yes.
Selberg,
Yes.
Sale,
Yes.
Starr,
Yes.
Brecky,
Yes.
Erickson.
Yes.
All right, that passes 8-0. We're now at our general public input portion of our agenda. As a reminder, input during this portion will last no more than 3 minutes per person, and in total last no more than 30 minutes. During general public input, the public is welcome to speak on any topic that does not appear later on the agenda. For regular agenda items following general public input, comments are limited to 3 minutes unless the item is being presented for final adoption, in which case public input is limited to 5 minutes. For all regular agenda items, comments are limited to the agenda item under consideration only. Also, for those of you who are new to city council meetings tonight, this is for general public input. So We'll cover agenda items later, and we'll have opportunity for public input at each agenda item. So if you're here to speak about one of those items, you can hold tight, and we'll take all that comment during that time. So at this time, I'd like to invite anyone from the public forward. And clerk, please note our time is 7:05. Good evening.
Good evening, Bruce Danielson. I'm going to ask each of you, because you got an email this weekend from me, what SDCL 1-27-1.16 is. You should have all seen it. Probably saw it on South Dakota. Last week you had 3 votes. They were illegal votes. I come here tonight looking to see if there is those 3 items covered under number 12, 13, and 14, if they were on the table. They are not on the table. If they aren't on the table for this crowd in this room tonight, that will be open meeting violation number 4, number 5, and number 6, as I laid out in my email to you. Those documents must be in this room. The law is very clear that those are to be printed and in the room for the audience to be able to be part of this meeting. So if you care to have some more illegality, I've already got attorneys that are actually very interested in this. So I'm going to have some fun with it, because you guys are going to have some fun with it. I was listening for a few minutes this afternoon at the end of the Tut Hill House discussion and then the public input. The Tut Hill House is enough reason for Don Kearney to be fired as Parks Director. This man has a master playbook of making sure that whatever isn't concrete and new gets torn down in this town. He has gone through the Indian Burial Wall, the Spellerberg Pool, multiple different park projects, including the Terrace Park project, that he wanted to tear apart the character and fiber and the history of this community. And he doesn't care if he hurts this community and our history. The legacy of this town is falling apart because we decided we're going to have a parks department that is concrete. We can't have cobblestone. We can't have quartzite. We can't have real artistic endeavors. We have to have somebody coming in doing a confluence or somebody's master plan of concrete. And we need to do something. And I would like to see those items put on that table so that this audience knows what's going on here tonight. Thank you.
All right, thank you. Anyone else for general public input tonight? Good evening.
Yes, good evening, councilors and mayor. I have 3 different things I'd like to just share with you very briefly. Rick Altoff here in Sioux Falls. The multi-million-dollar 26th Street and I-229 interchange project, which is approved and supported by the city, has a penalty clause of $6,500 a day if all lanes are not open by October 23rd. All lanes are not open even as of today, and as of today it was really a mess. The 3-year project had sufficient time to comply and complete. This has been an extreme inconvenience to the Sioux Falls. The inconvenience has even heightened when the schools, of which there are numerous in the area, opened. I request affirmation that the penalty clause is being enforced, and if not, an explanation as to why it is not. Thank you. Because of the human condition is such that we thrive in a society which is based on a community of individuals, and each individual is comprised of the physical, intellectual, emotional, psychological, and spiritual factors which allow us to thrive in good times and not in so good times. It is not affirming to restrict opportunities which would be nourishing for relationships which can be established and perpetuated to enhance understanding, respect, and love in any situation. I suggest emphasizing social distancing and not mandatory masks for all. I personally say to my friends, I can't wait to see your smile. Unless you have some sort of an alternative agreed upon, I do not support discouraging citizen input.
Rick, these are items that are on our agenda. As I mentioned, you have to wait till those items come up to speak on that. So thank you. You can speak to those when they are read into record. Anyone else for general public input tonight? Good evening.
Good evening, Dennis Haugen, Sioux Falls. I'm here to sell Sioux Falls to the world. Now, the way I use my judgmental system is I grade on the curve, you know, the bell curve, because you really can't go by who's perfect, because nobody's perfect. It really gets down to who's bad, who's best, and who's better, or who's better and then best. Tonight I'm going to talk about traffic. I'm going to put Seattle over here, way over here on the left, and put Sioux Falls way over here on the right. If you were in Seattle and you contend with the traffic, and this you can use to sell to employers and sell to people who want to work here. Many people, an 8-hour workday is up to 12 and 13 hours. By the time you get to work, 2 hours, then you put in 8 hours, and then you put in 2 more hours getting back. Can you imagine how torn, if you're an employer, how torn up your employee is by the time he gets to work? I don't know anywhere in Sioux Falls you can't get around very quickly. Even tonight, wow. You know, if there was a third of this snow in Seattle, it would be a 15-hour day for you. By the time you did your 8 hours of work, by the time you commuted, by the time you come back home, you're all wore out. You got no time to go to a council meeting because that'd be another hour to get there. No, there's no better place from the traffic angle. Now, I've already given you 3 A's. This is another AA plus. It's traffic. The overall situation and what it does to the quality of life. Now, just as, you know, I gave you an A on how well you handled riots, but just as a note here, Seattle rejected the law and order candidate for governor. They rejected it. They don't want law and order. And that besides, they don't know what to do when a riot starts because the governor doesn't want to talk to the president. Anyway, and I talked to you about it. I've talked to you about how well you're doing riots, but I'm concerned. There are people watching probably. And I can say to all those people who might be watching, this is a great place to live. And I've checked out a lot of cities before I came here. And it really is a very great place to live. Traffic is one item. Next time when I come, I'll have another item. This is going to take a year. You're going to get a lot of A's because I use the comparable system of making judgments. You're not perfect, and
Thanks,
nobody
Dennis.
is, but who does it the best?
Appreciate it. Thank you. Good evening.
Tim Stenga. I'd like to ask the mayor and some of the city council if we could take the cameras off the citizens of Sioux Falls and we put the cameras on the city council and the mayor. So that way the citizens of Sioux Falls can see how the city council and the mayor treats the people that come in and give input. Because I think it's time that the citizens of Sioux Falls see the true city councilors that we have to stand in front of and talk to, and to see how we get our faces and how we get our smirks and how we treat our public. I've always understood that I've lived in Sioux Falls all my life, I've paid my way to stand up here and talk because I do pay taxes. When somebody comes out and says, well, these people have paid to come up here and talk, I'll tell you what, I've paid my fair share of taxes too. And I am a citizen of Sioux Falls, born and raised. But I would like the citizens of Sioux Falls to see the truth on what we have in a real mayor and our city councilor, to realize why we come in here day after day and we fight for our rights.
All right, thank you. Anyone else this morning for general public input?
Sioux Falls. I'm here on behalf of the police department. Again, I'm going to stress to y'all, the police cannot come up here and tell you this. I had a long conversation with the sergeant. The milestone system that you're aware of, we need to put more in the budget. Right now, the high crime areas are Mr. Norm Drake's property of paved that the police is going to when police calls, not the calls from inside. They're calling from the outside. So with the milestone system, they put cameras up to catch the crime. La Creta, Mexican bar on West Madison is where the high crime's at. The sergeant told me if I can come up here and ask council to please put more cameras, do more for the milestone system. We need more, they need more cameras and more data. We can find the storage. There's a few council members that can help find the storage to place it. But I should not have to come here on behalf of the police department and speak on their behalf. And don't tell me that that's not the truth. The city attorney's office and the mayor's office and our police unions and upper management is supposed to be hearing these policemen out on this thing here. I'm asking council to pull Lucky Ladies for the consent agenda on December the 1st, 2020, as we're going to have a lot of people speaking on public input on Lucky Ladies. If somebody can pull that, that would be great, because I am the president of the Neighborhood Association for Pettigrew, and I'm asking somebody please do it. Okay? People that don't want to get involved in our neighborhood in crime is going to be one-termers here. I'm telling you right now. So every council member needs to be up on crime. That should be on your priority list. Central, Nitrous District, y'all gotten phone calls from the upper class, high-end people on police calls for service because they couldn't get to the police calls. And I'm not gonna mention the developers and the brokers and everybody that reached out to y'all because I made them do it. The crime needs to be y'all's top priority here. We need those camera systems set up in high crime areas. So again, please, the milestone system, please help the police department. Let's give them what they need in that budget. Let's find the storage and get them some more cameras. Because Mr. Norton Drake and the rich people don't care. You want to fight, let's go outside on city property and let's duke it out, because that's what the rich elite is doing there. And don't tell me I'm lying, because I heard it from the sergeant. The sergeant called me up and had an hour and 17 conversation about it. So let's take care of our businesses downtown, but let's hold them liable to police calls for service.
Thank you. Good evening.
Greetings. I'm David Zokaitis, and I do, can you fix that? Rotate too, please. I'm David Zokaitis, and I do a lot of thinking and planning and trying to optimize how we might do things a little differently. So tonight I'm thinking about how we might optimize or change city council invocations. Thank you, Sierra. All right, so typically what we do is we say a prayer first and then pledge allegiance, and all of that's nice enough, but it doesn't do very much for the atheists and the agnostics in the world. They're kind of left out. So I wrote an invocation that might be suitable for that part, for those people. And there it is. Okay, we can pledge allegiance to the truth, loyalty to the people. We can pledge to protect the earth, and allegiance to the United States, and work together. Seems like a great secular invocation. But sometimes people like to pray too. So I wrote something very nice for that environment. I took the other little invocation and wrapped a Dear Heavenly Father around it, asked for some help and some guidance, and there it is. I think it came out really well. That's page 1. And there's page 2. Dear Lord, thank you for your help and give us some guidance. Pretty nice way to do it, really. And then, of course, we should try to enjoy our city. And that's all I have for tonight, so good evening, everybody.
Thank you. Anyone else for general public input tonight? Good evening.
Everyone. Ryan Tisdall, Sioux Falls. This is Henry.
Hi, Henry.
Garden City Government. Hiding under a chair. I'm here tonight to talk about the strong leadership our city has. Sioux Falls is lucky to have Paul as our mayor, along with the strong leaders of the city council, in addition to a great city staff. It seems like since Paul was elected 2 years ago, he's had to manage one crisis after another that our city has faced. And quite frankly, he's done an incredible job. We are lucky to have him. And for the city council, you make important decisions that help shape the vision of Sioux Falls. I think we can all agree the pay you receive comes nowhere close to covering the incredible number of hours you put into your work. As Marshall Selberg and I have worked together in the past, I witnessed firsthand the dedication and time it takes to be a city councilor. People sometimes forget that you being here means you're spending time away from your families, your kids, your spouse, or your new baby. Everyone's time is precious, and the time you put into making our city a better place means a lot. And behind the scenes of the city is an incredible staff of professionals at City Hall and City Center. I personally work with the planning, zoning, and engineering team members on a regular basis, and I cannot stress enough how much I value their insight, input, and professional guidance. The volume of work they manage is massive, and they do a masterful job. To the leaders of our city, I feel like you don't get enough thank yous for the job you do. I know that people feel the need to come to the city council meetings on a weekly basis to berate you, beat you down, and tell you you don't do a good job. Please know that this vocal minority does not represent the people of Sioux Falls. Being a city leader doesn't mean you need to be a punching bag during public input. It doesn't give individuals a free pass to disrespect you, cut you down, and bicker on a weekly basis. Public input was never intended on being the city's complaint department. I, along with hundreds of thousands of others, feel you guys do an exceptional job navigating challenging situations. The dedication and vision you display each and every day is incredibly appreciated, and for that, I simply want to say thank you for all that you do.
Thank you, Ryan. Thanks, Henry. Anyone else here for general public input tonight? All right, we'll move on to our next item then.
Item 12, second reading, an emergency ordinance of the City of Sioux Falls, South Dakota to require face coverings in an indoor public place where 6-foot social distancing cannot be achieved.
Councilor Sale.
Thank you, Mr.
Floor is
Mayor.
yours.
I'm going to try and be brief because I will tell you I'm just about talked out. First off, for all of those that have provided the council and the mayor with the input over the last few weeks, I'd like to thank them. I will say that it has overwhelmed our system. I am backed up hundreds of emails and phone calls personally to try and get back to you. But I do appreciate the input, and some of it's been very moving. One of the reasons we brought this forward at this time, it's a public safety issue. I thoroughly believe when you inspect the numbers that are out there that we are in a crisis right here in Sioux Falls at this point. We're in a crisis for public safety. Since the 1st of November, we've lost over 100 people in the state of South Dakota. Now, the state of South Dakota will identify those people by the county that they originate in. But they're dying in Sioux Falls. They're dying in our hospitals here. So that's one of the things. As I listen to our people that are in the healthcare systems, they're in crisis. They are maxed to the limit. This is a public safety issue, and You know, for 20 years I was a fireman in Sioux Falls, and public safety is what I did. Now I continue on with that. So this is about us as a city. When you wear this mask, it's more to protect your neighbor than it is to protect you. And there was a time in this country that we worried more about our neighbors than we did for our own personal safety. So that's one of the things. We talked about, I'm going to be brief about hospital bed capacity. As we listened last Monday to Dr. Elliott, he talked about doubling up in the ICU beds at Avera. I don't know if that's appropriate, but if it was me, especially if it was my wife, I wouldn't want her to be sharing a room with anybody else in the ICU. Counselor Kiley and I, along with several others, and a lot of these counselors have had input on this, to try and make it so it is friendly as possible to our city. We don't want to close down any businesses. That's why you will not see any language in here that restricts the occupancy of businesses or locations. If you could roll the clock back 6 months, we had those ordinances in front of us. There was a first reading had passed. We went to the second reading when they were actually taken back because things started to evolve and change with the coronavirus. But there's no limits to occupancy here. We also want to keep our people working. We don't want people that have to stay home because they have the 14-day quarantine or they infected. Our society and our citizens today revolve around all of us working. With a 3.4% unemployment rate, most of us are working. We don't want to ratchet that up for unemployment. And one of the other high points that we've done in this is we want to keep our kids in school. That's why if you do a close read of this ordinance, and we will have some cleanup language tonight, it doesn't mention schools. After consulting several school officials and superintendent of schools here in Sioux Falls, I feel they're doing a good job. They're doing the best job they can to educate your children, to educate my grandchildren, to keep them in schools and keep the schools safe. So I want that to continue on. I don't want to have our heavy hand on them. I'm going to go to the next graph here. Look at this. This is where we are at today. We have just gone skyrocketed the number of active cases that we have in our state. I wish we could locate these more closely, but the information that we get, this one came from our own city, but it's based on the information given us by the state. But you can see this is a terrible trend that we're on. And with winter setting in, and thank you for all the safely driving down here tonight because it was a mess, this is gonna continue on. My opinion, we don't see any abatement. Now we got Thanksgiving coming. We got kids coming home from college. I think we're gonna continue to have it. You look at the next graph here, we talk about hospitalizations. Early on, when we started having daily briefings by our healthcare officials and the mayor, that was the big key we were going on. We didn't want to overload our hospitals. That's why we were going to go to some occupancy. We were going to go some more and more restrictions. So today we're there. We're at that. 210 currently hospitalized, and that will just continue to go on. If we go to the next graph, you look at our testing. This is our infection rate per testing. We've gone up from, this is just all the way back to August, we've gone back from a little like 12-15% infection rate per testing. Now we're up almost to 50% of the people being tested are positive for COVID. That is a terrible, terrible trend. And as I drive down Minnesota Avenue and I see the cars lined up for testing, actually, it breaks my heart that that many people are going to be infected. And I know of people that are sick and will not get tested for several reasons. First off, they don't want a stigma. They're concerned about the long-term implications on their health care, so they're not getting tested, and they maybe should. That's anecdotal. If we go to the next page here, we're going to show you a graph after this that talks about states that have mandated masks versus non-mandated mask policies. And this is the data that has been drawn. The mandated masks are on your left, states, non-mandated on the right. If we go to this graph right here, you can see the non-mandated states have a lower infection rate per 100,000 than the states that are mandated. That is proof right there that this mask mandate does work. The gray line on here is the state of South Dakota. you can see how we've all peaked. There have been several events in the last 4 or 5 months that have contributed to this. I'm not sure where they're all coming from, but we know that we have a crisis here in our state. And as the mayor has said, we can't control the state, but we can control what goes on in Sioux Falls. So as those people travel to Sioux Falls to do their Christmas shopping, they come, whether it be coming from Volga or Viborg or wherever, they're not only exposed to those of us that are infected, but they are also bringing that here to us. So there's a commingling and intermingling of this whole region. We don't have the figures on what is happening from people from Laverne or people from Sioux Center, because it's a different state. How many of those people are in our hospitals? We don't know. And we know that our healthcare systems provide for a lot. So just a few little bits on the details here, the ordinance. Face coverings and masks are not required when you're able to social distance for 6 feet. This is an example of you sitting out here. If you're 6 feet away from your neighbor, you're not required to wear a mask under this ordinance. That's what, if the CDC says 6 feet, that's what we're going with. Second bullet point, if you're under the age of 5, we understand how that is very restrictive for a small child. If you're seated at a public place to eat or drink, or while you're immediately consuming food or beverages, you can't go to a restaurant and wear a mask and eat a pizza like I just did. You got to take your mask off. We understand that. That's why it's not so restrictive. If you're receiving dental or medical care that prevents you from wearing a face covering, common sense. If you have a medical condition, health condition, or disability that makes it unreasonable for the individual to maintain a face covering, this is also just common sense. Conversations that I've had with law enforcement is we don't expect people to carry a medical slip with them. If a police officer or somebody says, why aren't you wearing a mask? And you say, I have asthma or I have a medical condition, we don't expect them to carry a Rolodex of confirmed doctors to do that. They're going to give you the benefit of the doubt. One of the things that has been brought up a lot is about enforcement. We had people on record saying that this was unenforceable before the ordinance was even drafted. And I take issue with that. Our law enforcement in Sioux Falls is second to none. They enforce this in Fargo, they enforce this in Omaha, they enforce this in Rochester, they enforce this in Brookings. Our law enforcement can do a better job than they can. So enforcement has just become a red herring that people that don't like to be mandated are using it. But I have utmost faith in our law enforcement here, and I've had several conversations with Chief Burns about how it be implemented. One of the ways that I believe that, and this is Chief Burns will implement it because I don't pretend to be the chief of police, but if you come into Kurt's Radiator Shop and you're not wearing a mask, police officer is called. I would recommend that it be the non-911 number that they'd be called. Police officer shows up and says, Kurt, why aren't you wearing a mask? And if I say, well, I don't have one, I would like to supply that police officer with a mask. So he can say, please put this mask on, you put it on, end of the deal. If you don't put it on, my recommendation to the city attorney's office and to the police chief would there would be a $50 citation. That's my recommendation, but it's out of the city council's hands how to do that. The ordinance is already in place. It's the same ordinance for the smoking issue that we have today that this would fall under. So I personally do not think it's going to be an issue, and I think it's a red herring. Lastly, before we're done with this, I will have an amendment that will clarify a few things. It will exempt swimming, sports teams, and in certain instances, public safety workers. I don't expect those little kids out there playing soccer and little kids out there on the hockey rink to have to wear a mask. I understand that, it's common sense. And you do not need to social distance if you're with a family or a group of friends. So if you take your family of 6 and you go to the Denny Sanford Premier Center and you want to watch a basketball game, I don't expect that family to wear a mask at that point. They can sit together. Last thing we've added to this was going to be a sunset ordinance on December 31st, 2020, or whenever the mayor decides that there's no longer a public emergency, whichever one comes first. That way, it gives you, the citizens, knowledge to know that we will look at it again at that point to see where we're at if we have to make further adjustments. That is my presentation. I know Councilor Kiley has a few words, and he's a lot more eloquent than I am.
Thank you, Councilor Sale. Councilor Kiley, go ahead.
I will wait until after public input. Thank you very much.
All right, sounds good. All right, we are going to take public input now for this item. So how we'll do this tonight is after 1 hour, the council chair reserves the right to limit the number of speakers on this item. I'm not saying we'll do that. That can be overridden by the council as a body. But the point of doing that is let's take an hour testimony. And then let's look for new arguments, things we haven't heard in the first hour, because I think we'll probably start to hear a lot of the same things. So after 1 hour, I'll make that known that we've hit an hour, and we'll look for some new arguments at that point. And so what we'll do is it's first come, first serve. If you want to form a line, you sure can, but at this time I'll open people up to come forward. And just for the record, it's 7:36 right now.
Sarah Bruce, so after an hour, please override the mayor. Because if it takes an hour, 2 hours, we're on the taxpayers' money. Okay? We don't want to be like Mayor Uther, do we? So I'm going to use Kurt, Sell, and Kiley. They want to bring it up. We're in a crisis.
I only have my copy.
Right? We're in a crisis. How many people that we're fighting crime on these streets, people in Central and Whittier, that we're not on? And I wish the police could come and tell you. The police is short-staffed. They're going call to call to call. In my neighborhood, they're going 17 to 37 minutes on a 911 call. So where in the hell does he figure that Chief Burns is okay with this? Upper management will, but what about the policemen? So I will speak on behalf of the police department. We're dealing in a crisis with the police going call to call for crime in Pettigrew and Whittier neighborhoods, going call to call on PAVE with the bar fights and the stabbings and the sexual assaults and rapes that are going on the streets at Whittier and Pettigrew neighborhood. 2 children got sexually assaulted 3 weeks ago. That's a crisis. Where are we at on the crime? Absolutely. I get wearing a mask, but this is ridiculous. The police don't got time to mandate a mask. They're going from call to call and call, can barely keep up with 911 calls. And I swear, as I sit for you today, I wish I could pull up those reports, but I will speak on the average citizen of the police department that they are overwhelmed. They are spending 12 and 16 hours. Can't go home to their families and only can get a bathroom break and can't eat because they're going call to call to call. Do you think that they're going to come for a mask mandate? Are you kidding me? Kurt Steele, he ran in Central District that has high crime. We're in a crisis of human trafficking of children. Children, dope dealers, running kids in Central District. Yes, they are doing it. I'm out on the streets fighting it. And we're in a crisis and we can't get no help there. People beating the crap out of people and not getting no help. And we're worried about a mask mandate. People spitting on officers that have HIV. But we're on a mask mandate. We got our priorities backwards here. We're not breech babies. We didn't come in the world butt first here. I don't have tolerance for council members that want to represent the highest districts of crime and think that this is a crisis. We're in much of a crisis than a mask mandate here. We're in much of a crisis. And Kurt Selke, come with me after council meeting and go in these streets. Just take it. 8 years old and 11-year-old sexually assaulted. Don't you think that's a crisis right there? My blood's pumping because I had to deal with it. Don't you think that that is a crisis? So next election, we need to look at who is voting on this nonsense here. People will die. People will die of the virus. Look what happened to the H1N1. People will do it. The hospitals are overloaded with patients. How about your policemen that are short-staffed that we got to worry about if they commit suicide? How about that? Because they're going to sexual assault of children in high-crime areas. Domestics, where the girl can't even walk because he beat the crap out of her so bad. Don't you think that we need to look for our police officers too that are overwhelmed, that are bringing these children, these sexual assault cases to the hospitals, and perform rape kits on children and on adults? I can't begin to tell you, but I wish I could open my mouth on who did this, but it's an ongoing case. But the hospitals know what I'm talking about. So this mask mandate, you got to get your priorities straight. Kurt, Sal, and Kylie need to come on board. Just because we don't have high crime in the rich parts of town doesn't mean that it doesn't affect everybody in the neighborhood. Kylie does not have hardly any crime in his district. But let's take a tour in the high crime areas and let's talk about a crisis. Let's talk about trying to split up a fight and you have blood on your hands. Women getting sexually assaulted because they owe the dope dealer money, so he sexually assaulted her in a garage.
All right, come forward. No applause is needed tonight for any of the input, okay? Please come forward, ma'am.
Hi, good evening. Thank you for the opportunity to speak. My name is Sandra Melstead. I am a public health professional and a citizen of Sioux Falls. I'd like to put on record what's being passed around to you is a signed petition of over 1,500 signatures from local faith leaders, health experts, and I'd like to read that to have it on record. Letter to support a Sioux Falls, South Dakota ordinance to mandate mask wearing in public and in commercial establishments. To Mayor Paul Tenhaken and City Council members of Sioux Falls, South Dakota. As the largest, most diverse city in the state, we should be leading by example. As elected members of the city, it is your role to enact policy to make the public safe. We are writing on behalf of our organizations, members, employees, and customers of our businesses, attendees of our faith institutions, and of all citizens of Greater Sioux Falls. To express our support for an emergency ordinance of the City of Sioux Falls, South Dakota, to require face coverings in an indoor public place where 6-foot social distancing cannot be achieved. We strongly urge you to support this ordinance, which will protect the health of our community, especially those vulnerable to the impacts of COVID. It will also allow Sioux Falls residents to engage more fully and safely in public life, thereby allowing our businesses, schools, and places of faith to not just survive, but to thrive. This past week, we have seen a surge in COVID cases across our state and in our city. We need immediate action to slow the spread of disease, which is already overwhelming our health facilities. There are currently more than 4,464 active cases and 189 hospitalizations. Prior to yesterday, our active cases broke the previous day's new high for 23 straight days. 189 hospitalizations was also a new high, breaking the previous day's record high. In short, we're surging in the wrong direction. We do not believe that we need to take a choice between the health of our loved ones and the health of our local economy. It is a false dichotomy to think that effective public safety, like requiring mask wearing in public, is in conflict in keeping our businesses, schools, and faith institutions open. Rather, the city ordinance will help ensure that we are able to do just that. Sioux Falls prides itself on taking care of its citizens. Following the tornado in 2019, community members rallied together to ensure the safety of all those living in our city, and it's time for us to once again protect the health, safety, and well-being of our friends, family, and neighbors. We believe the city ordinance is the best tool we have to address a growing health crisis and to stave off an economic one. The city ordinance is about taking proven, effective, low-cost, and relatively easy protective measures to keep all sectors of our city open and all of our city's citizens safe. This is not a partisan issue, and it shouldn't be a political one. Is a community health and safety issue. And as you well know, Sioux Falls is a community where we care deeply about both. This is signed by faith and health leaders within our community, including physicians through Avera Health, faith leaders in our community, and business owners. So I'd like to have that on record. Finally, as myself, I'd like to take a few moments just to talk about my role in public health and as a citizen of Sioux Falls. As I mentioned, I'm a longtime public health professional. I've been working in public health for over 15 years. My work is guided by data and a commitment and a responsibility as a public health professional to protect the health of the populations through prevention, collaboration, and improving health equity. I'm here this evening to lend my voice to support the mask mandate for the community I live, I work, learn, and play in. Masks are recognized as one of the most effective available tools to mitigate the spread of COVID-19. Because people do not show symptoms for up to 2 weeks, anyone could be spreading it without realizing it. A cornerstone of public health practice is evidence-based decision-making driven by data. Data shows that active COVID cases, as we saw earlier, are active in Sioux Falls and unfortunately are continuing to spread upwards. Vulnerable populations continue to be disproportionately impacted by COVID-19. A growing body of evidence highlights masks can be the difference between life and death. And recent data shows that the impact of public health mandates, such as in Delaware, found declines in COVID-19 transmissions, hospitalizations, and mortality. Policy also plays an important role to ensure the health of populations. Some of the greatest achievements in public health in the 20th century have been achieved because of policy, law, and mandates put into place, including control of infectious diseases, seatbelts, and immunizations. And these have happened through data-informed decision-making and collaboration. As a citizen of Sioux Falls, I welcome the opportunity to engage with my community again, friends, family, and colleagues. And as a public health professional, I welcome the opportunity to continue to thrive and engage in a public health environment that is supportive of the health of all the population that
Thank
we
you, Sandra.
work and play.
Appreciate it.
Thank you.
Good evening, sir. Or who's ever hiding under there. Good evening.
You guys want masks, don't you? My name is Matt Condon. I live in this city. I want to make a point on your prayer earlier today about unity. Unity is not what you're going to get when you impose things on people, when you impose things that are highly debatable in their effectiveness. You will only create resentment toward police officers who, as that lady mentioned before, their jobs are already very difficult. I don't doubt that officers will be courteous and professional as they enforce this, quite frankly, tyrannical measure that you guys want to put up, but I still say that the ordinance will be unenforceable. The cops will be completely powerless to strap this onto the people like you guys want to do. And something I mentioned last week when I was here, no studies have already been done using high quality, I think they're called N95 respirator masks. They were measuring the effectiveness of their masks in preventing the spread of the virus. And the no statistically significant, as they phrased it, decrease in the rate of spread was found when they used these medical grade masks. So on that point, I want to point out that masks, I realize I'm contradicting someone that works in the medical field. I think her name was Sandra, but I still think that the people that did that study knew what they were doing. And also the death rates, I think his name is pronounced Sale. The death rates that he mentioned are also highly debatable, as people have been known to place COVID, and by people I mean hospitals, they've been known to place COVID on death certificates, even though it's debatable that they died from COVID. They only had COVID when they were dead. So the death rates are very hard to measure. And another issue is that hospitals have been known to be paid to place COVID on death certificates. Exactly why that is, I don't know, but they're paid fairly large sums of money to put COVID on death certificates. This also further complicates the process of verifying the actual death rates that Counselor Sale here has been using scare tactics with. And also, I have family that works in the healthcare industry, specifically in a nursing home. And one time, there was a lot of sudden positive cases, and they were, soon afterward, those same people tested negative. So from what she tells me, they can't even reliably test for this virus. So right there, you have three factors that make it next to impossible to verify the true infection rates. So, and I see the word crisis being thrown around a lot, partly as part of Counselor Sale's scare tactics. The only crisis that I see here are counselors that are anxious to use force on people simply for not wearing a mask. I reiterate that, you're using force on people who have done nothing wrong. And I also want to express my opinion that the ordinance will not sunset at the end of the year. I think that you guys will have successfully experimented with the new power, and you will want to expand your powers at that point. And another, in a country in Europe called Sweden tried a strategy called herd immunity, and their death and infection rates, again, were hard to measure, but their death and infection rates were not significantly different from other European countries that not only had mask requirements, they had lockdown requirements. And Sweden's rates of infection and death were not statistically significantly different. So there we have an example of the effectiveness here being questioned. And all these other points are points I just made last week too. So thank you for listening.
Okay, Matt, thank you. Good evening.
Chris Oines. I'm here to speak from a different section of the healthcare industry that isn't able quite to speak for itself most of the time. The personal caretaker. I'm a father, a husband, a full-time worker, and a full-time personal caretaker. My wife is wheelchair bound and homeward bound. But I'm only 37 years old. I cannot take the option to quit working just to take care of her. And to successfully and safely work, I think requires a mask mandate. If for some reason I bring this home, I might survive. My son will definitely survive, but it is a death sentence to my wife, almost certainly. There are several people that are personal caretakers in the same situation, in the same scenario. Can you imagine how I would feel not only watching her die, telling my son she's gone, but knowing that I was the person who brought it home because I had to go to work as well? I hear a lot of people say that this will place an undue burden on the law enforcement industry, but really it displaces the extra burden and stress on the healthcare industry and on personal caretakers. And I think we need to keep that in mind as well. We are the ones shouldering all the stress and all the burden at the moment. Why can't the burden be spread around until we've successfully found a vaccine or a good full spectrum of therapeutics to bring this virus around? Thank you.
All right, thanks, Chris. Good evening. Come on forward, ma'am.
Good evening. My name is Andrea Glasgow. I'm not sure how this thing works.
We'll flip it on for you, and you just step close to the mic so we can hear you.
Thank you. Sorry, I am a quiet speaker. So I am a healthcare professional in this city as well. I am a chiropractic assistant. I am a first-line therapy certified lifestyle educator in disease prevention and disease management. That is criteria that is given to us and trained to us by Metagenics, which is a third-party certified supplemental company that allows only for physicians to be able to have access to their supplements. So it's a high honor to hold that since it's no longer available to some people in my field without a medical degree. So right here in front of you, I have something a little bit different, and I'm stepping in front of you today with the assumption that everyone here has the care that they say that they have for the constituents that you're talking about. It's a very passionate topic for a very good reason. There are lives at stake. There are also other things that can speak to the influx that we've had for the past couple months here. Some of the studies that I provided, and I gave a very short version, but I have a hyperlink available to all of the published medical review studies that would reference this. There are things that have been documented since well before this disease. Secondhand smoke increasing the rate of infection for different diseases. We have in August 2000 health effects from inorganic agricultural deaths, and they increase the exposure rate and they lower the immune systems of those that are around them. And I want to just kind of, I guess, just tip my hat to the fact that we are in a grain belt, and so there isn't without this stress on us. And this stress happened just months ago, a very close correlation when everything kind of took a spike for it. There are links also to the fact that smoke and inhalants cannot be filtered through air filters in the home, and you still have the type of cytokine response that you would have, so there isn't a protective measure even within our homes from some of these allergens that we face. I put a couple other things in there too. Fragrances will do this to us. The sinus infections and upper respiratory links are also there. Within there, you have epithelial barriers that line the mucosal organs of your body, and they are there rather than a mask. I believe that we would have been born with them had they been necessary for protection from a viral pattern. So also to the top of it, July 2018, opiates have a gigantic negative side effect, and they depress the respiratory function, they lower the natural killer cells and T cells, and they've actually been correlated with a higher risk of infectious diseases such as pneumonia. 2018 was when that study was done. The morbidity rates are listed also for high farmers in agricultural areas, and mortality as well from these types of pulmonary diseases. So this isn't the first thing that we're facing in front of us. And I think the rest of the country is looking at us and they see no masks, or they see the lack of a mandate for a mask, and they imagine that that goes along with our rates of increase, but I don't believe that that's so. And I sit before you today because you are here to stand up for us. And rather than being shamed for the choices that we've made, and rather than being locked out of states where you have young girls who are not allowed to play in soccer tournaments because they live in South Dakota, and they've qualified for a regional tournament that they were no longer able to go to. It's a missed mark in front of us, I believe. So you could go through the extra action of bringing forward the mask mandate and then enforcing it on top of that, or we cannot miss the mark on this opportunity to take a look at ourselves, to take a look at the immune system that we have been given and the disregard that we have had for that. So thank you very much.
Thank you, Andrea. Good evening.
Good evening. My name is Landy Schweigert, and I am also a Sioux Falls resident. I'm a mom. I also work at a daycare, and I'm a domestic violence survivor. I've been really quiet about how I feel about masks because I don't like to stir anything up. I'm a peacemaker, and I know that your jobs are already very, very difficult as it is. But I have been given a strong voice in my journey in advocating for domestic violence survivors, so I want to be raw and share my perspective in hopes to give you all the some insight on what someone who has been through what I have been through might feel. So I almost lost my life a few years ago at the hands of another. The other used their hands to cover my face, to apply pressure to my neck, and to silence my cries for help. When I put things on my neck and my face, it sends an intense trigger through me. I have to wrestle with my mind whenever I put it on, and sometimes I spiral into an anxiety attack or I just completely shut down. I can only wear loose necklaces, and I don't do well with tight turtlenecks, shirts, anything like that. So I'm not just being like a mask, person that's like, oh, my freedom. No, this is for everything. On the same hand, I love people. I love people so much, and I love making people feel safe. So I do my best when I do go into stores. I put it on, I fight my mind, and when I'm around people that I know aren't comfortable maskless, I do my best to accommodate. My parents are both COVID nurses on the Rosebud Reservation, but the amount of times I've been called selfish, been called names, been told that I don't care about others during the moment where I simply can't bring myself to wear my mask is absolutely ridiculous. Two of the most important people in my life are on the front lines, and I know that they're fighting for me just as much as I'm fighting for them. I know that if I have to wear a mask for more than a few minutes, my mental health would be severely affected. And not everyone is like me, I understand this. We all have different life experiences. The gentleman that has the wife that's in a wheelchair, he has a different life experience than I do. We all have different traumas, we have different fears, and we handle them all differently. But it's so important that we love each other and that we realize that we're all humans in need of that compassion. There's so much division, and it hurts to see. Can we just love our neighbor for exactly where they are without demanding that they experience things the same way that we do? Can we stop demanding that our personal fears and traumas are more important than what someone else might be feeling or going through? Domestic violence cases have actually increased 12% since the pandemic has started. I think that, and that's just in Sioux Falls alone, and I think it's important that we continue to give a voice to those that have had theirs taken, even if it means understanding that protecting the public safety is deeper than a one-size-fits-all solution. I'm asking you on behalf of the thousands of survivors in Sioux Falls that do have these triggers and traumas not to pass the mask mandate. Thank you.
All right, thanks, Landy. Good evening.
Good evening. Thank you, Mayor and City Council, for listening to each one of us as we come up here tonight. And
Can you state your name, ma'am?
Brooke Brown. I'm here and I am a resident of Sioux Falls. And I just want to start with the obvious statement that I think everyone in this room and everyone that is watching can agree with, that any loss of life is tragic, period. And after all of that, that's why we're all here tonight, sharing our opinions, sharing how we feel about this mandate that you guys are trying to put into place. And it's tragic that the amount of people that are suffering with mental illness, substance abuse, broken relationships due to this virus. It's tragic that our local businesses are suffering. It's tragic that this issue in the land of the free that we all get to sit here and give our voices for has been politicized to what it is now. Because I've seen it across the entire country. And it's tragic that this divide has already created in our country and its people and with our children. It's tragic that what we're seeing and what they have to look at as an example on how they act towards others and how they treat others. It's tragic to see how the emotions have overtaken some, and it's tragic to see that the leaders of our city, each one of you that's in front of me right now, are out of unity. When right now, unity is what our country needs most. It's tragic that this may come down to leaving this decision to our mayor. As a proud citizen, I can not only justify our police department having to patrol fellow citizens who choose not to wear a mask. Our police force is an asset and a resource we need immensely. You just heard Landy share her story. To help keep each one of us safe from those who choose to break the law and do harm to others, to help those who are truly in need of protection. And as a business owner, I do not want to see other businesses continue and who are already struggling in this pandemic have extra costs, extra stressors, another thing to add to the list. Finally, the most important role that I hold is a mother and soon to be 4 boys. It brings me here to stand in front of you. That's what's bringing me here to stand in front of you tonight. On this cold, snowy evening, we could all easily be sitting in our homes comfortable. I could have my feet up instead of being standing here as I'm 7 months pregnant, enjoying the great gift of being with my 16, 3, 1-year-old, and this one kicking inside of me. But that would be the easy and comfortable thing to do. Just like you and each citizen of this city, I have the choice to make easy and hard decisions every single day, but sometimes I get to step out of that comfort and get uncomfortable. I get to be the example to my boys, show them how to stand up for their freedoms, teach and educate them on health, nutrition, and how to take care of their bodies holistically, not slapping a mask on their face and saying, this is how we're going to handle this. I certainly don't teach them to lead out of fear and shame others for not thinking the same way that they do. We all get to set the example of how we want our children to confront challenges and exercise their faith in leadership. And what I know is when emotions are high, logic is low. Every single person that you've heard here tonight is speaking from emotion, their feelings, what they feel about this mandate. Again, emotions are high, logic is usually low. And as a 7-month pregnant woman, I would know a little bit about high emotions right now. But making decisions like you will be tonight on this potential mandate, will be detrimental and tragic to the city as a whole in every aspect I mentioned. So I'm asking you tonight to be the example for our city. Wherever you stand on this personally and emotionally and how you feel on it, put that aside. Do what Sioux Falls has done in so many other ways in different categories by being a national leader and setting an example for the nation to follow. If you truly want unity, show us tonight. It's time, and I'm asking you tonight to unanimously make a decision to not place this mandate upon our Sioux Falls citizens. Thank you.
All right, thank you, Brooke. Good evening.
Good evening, council members and my fellow neighbors. Sorry, I'm taking a minute here.
Take a minute, and yeah, there's wipes on the podium there if anyone wants to use them when you get up there. So feel free to do
Chlorine bleach smells like summer, and don't we miss
that.
summer?
There you go. Thank you.
All right.
Welcome.
My name is Jennifer McNamara. I'm a resident of Sioux Falls. I appreciate the members of the council and Mayor Tenhaken that opted to wear masks tonight to sit in front of us. I'm here because I'm here to speak on behalf of my kiddo. I'm glad that I went in line with other mothers because I think most of the moms in this city, we are leaders in science. Most moms will tell you that if you cover your face, if you cover your mouth and nose, it's going to keep your snot from getting on someone else. So that's all the science I need, is that my grandma and my mom told me, don't get your snot on anybody else. So I run with that. I also work in healthcare. I work in one of our hospital systems and see patients every day. And I know that there are physicians in the room behind me. I'm sorry that I went ahead of them, but this year, because of COVID-19, I made some changes in my life. I started wearing a mask every day at work or anytime I'm in public and could expose someone else. I work in a hospital, so that's a very real concern that I could be a vector, an asymptomatic carrier of the virus, and I could be moving it from place to place, even with my hands or on my clothing or on my shoes. I made other changes as well. Because of COVID-19, I increased my health insurance coverage, my long-term disability coverage, and my life insurance. I updated my will, my living will, and my medical power of attorney. I made my wishes known to my family in case I were to need to be hospitalized or ventilated, which takes away your voice, and in case of death. I made sure that my family knew what my choices would be. This is my kiddo. This is my daughter. And she means the world to me. When I close my eyes, this is the image that I most often see of her. She is very carefree and happy in this photo. The Argus Leader ran the same picture of my daughter a few years ago when I wrote a piece about the fear that came over me when I received a call saying that there was a shooting in her school. And I saw my baby, and I couldn't see my life without her. So to say we dodged a bullet that day is kind of trite, but it is true. I know what it felt like to know that before the end of her average school day, just being a kid, just going to school could have taken her life. And I'm not over that yet. This is my kiddo now. Her life has continued to grow and change. She has completed school and she works full-time every day. Just like me, she gets up, she scrubs up, she masks up, and she sees patients in one of our major hospital systems. At a time in her life when I am most proud of her, I am also fearful. As much fear as the day I worried she may have faced a bullet. The same as I made decisions and changes in my own life, I had to sit down and talk with my child about her health insurance and her life insurance and her wishes. What kind of care would she want to receive if she were on life support? What kind of coffin would she want to be buried in? Her grandmother, my mother, just passed away recently. I got to ask my daughter, would you want to be buried by Grandma? If something were to happen? If COVID were to happen? My daughter is on a shift right now, tonight, in one of our hospitals where more than 50% of the beds with patients in them are filled with COVID patients. Some of our coworkers are now our COVID patients.
Thank you, Jennifer.
I just have one more thing.
We got to really keep you to your time limit. We got a full boat, so we'll give you about 10 more
one more
seconds here.
sentence.
Go ahead.
Mayor Tenhaken, you had mentioned in the paper today that you thought tonight you would be put in the hot seat, that's your concern at your work tonight. And I fear tonight at her work that my daughter will contract a deadly communicable disease that's running unchecked in our community. That's my fear. Thank you.
Thank you. I'm really going to be a stickler on the 5-minute limit. There's a timer in front on the podium there, so go ahead. Go ahead, sir. Can you say your name?
My name is Alan Olson. I work at the Pentagon. We just had a team come in from Minneapolis, Wyoming, Montana, and North Dakota, South Dakota, Nebraska, and Iowa. They really appreciated that we put on masks. We told them to put on masks. They did. Those people coming from there far away, they really appreciate it. They said us thank you. They give us a lot of thanks. They said we're coming back to South Dakota again, but we cannot go from South Dakota to Kansas or Missouri. They won't allow us. So that's why a lot of the teams cannot go to Kansas or Missouri if they have a South Dakota license. And that's hard to travel. And we're facing that right now. But teams want to thank you all for letting them come in. We're going to get some more teams coming in the future, we hope. Montana might be coming in. We got Gonzaga might be coming. So I hope you guys all appreciate those big teams that's coming in the future that you already know already. So we really appreciate it, and we hope you all do your great job. And we'd like to say thank you all.
Thank you, Alan. Good evening.
My name is Jamie Scarborough. My husband and I, Jeff Dans, have Zambro's Variety downtown. And we live above our store, kind of in the thick of it down there. All the bars are still raging. No masks to be seen when I look out my window. But I want to talk about a purely business and logical thing here. The name of the game for me and for us here is to keep our economy running safely. And to do that, I think we need to require masks indoors, no exceptions. My employees are protecting each other at work, and the public that comes in, they're protecting us so we can stay open. We're coming up on Christmas, where it is going to be impossible. If you've ever been in Zambro's on a Saturday during Christmas season, you can barely walk in there. There's no social distancing that can happen. Otherwise, I'll have to hire somebody to let people in and out, you know. It gets really crowded. We need to have masks in there. If we don't, and just because we have such a small staff, and I've got more than one sick person, I'm gonna have to close my doors because there isn't anybody to run the store. And that's 5 families that we support out of work for 2 weeks during Christmas. I know, we generate the sales tax for the city, right? All of our small businesses. I mean, that's our revenue for our city. We don't want to head there. We don't want to go to shutdown. If we're all protecting each other, we can stay open. And we've been doing a mask policy since we reopened to the public in June. We require people to wear masks when they come in, and if they're not wearing one, I ask them to leave. And they do, so far. I've gotten a lot more thank yous than I've gotten threats. Thank you for taking this seriously. This is the only place I will shop because I feel safe, or I am immunocompromised or a family member is immunocompromised, and you guys are taking precautions, so I will come here. Now, for those people who can't wear a mask for whatever reason, because they are not well enough, or they have some mental issues, which are very real, by the way, and I can relate to your mental issue personally. I understand that that's triggering, and I appreciate that you try and do that when you come into some place that requires, because we want to stay open. That is the goal. But we also provide accommodations for people that can't wear a mask in my store. We have an online shop site, finally. We took that time when we were shut down to create one and repaint our store. I kept everybody busy and working. We do curbside. I've done some deliveries. I just don't believe in rewarding bad behavior. So I kick people out if they're gonna, swear at my employees or whatever, threaten them. And to literally not spread death. Come on, this is like a no-brainer. We need to stay open. I want to know the city has my back if I need to have somebody removed that is threatening one of my employees. I want you guys to have my back. And if I can enforce it, you guys can enforce it. I'm a middle-aged old lady who tells people to leave, and they do. Come on, it's not that hard. Also, I want to say that we are trending well on our business track. We had a great summer because people felt safe enough to shop with us. And we're on trend to do what we're supposed to do. I just want to say that, that it would affect your business adversely is wrong. People come to me because I'm enforcing a mask policy. And I want to thank you for bringing this to the council, and thank you all for listening to me. Thank you.
Thanks, Jamie. Good evening.
Good evening. Hi, my name's Shannon Emery. I'm a pediatrician in town. Thanks for letting us talk. I care for human life and relief of suffering. That's my job. That's our job and our life's work. And we don't have a political agenda. We're not worried about political backlash, and we don't have some hidden motive. Okay, people trust me to take care of their babies. They trust other doctors with their mom's cancer care, their brother's surgery, or their dad's heart attack. So please hear our calls for help. We can't do this alone. We need everyone to hear us as we say we are in this together. This is a worldwide pandemic, a worldwide emergency. It's been around for months, so we have learned some important lessons already on how to manage the virus. Worldwide, it's widely agreed upon by experts that wearing a mask is necessary in areas where you cannot physically distance yourself from folks. It is not disputed, and it is one of the most simple things that we can do. In South Dakota, we are light years behind in our response, and it shows. The Dakotas have the highest deaths per capita in the United States over the past 30 days. All the metrics show that we're in big trouble. Exponential increases in % of positive cases, our hospitalizations, and our deaths. Unfortunately, the reality is that we got way behind because our president and our governor have no interest in tackling this problem with science-backed strategies that have been shown to work. It is hard work to tackle this virus, and some politicians are just not willing to do that hard collaborative work. Please listen to your doctors and nurses. The healthcare workers have been sounding the alarms for weeks now. Okay, we saw this coming, and the calls for help have gone out from our hospital leaders. We have heard from our hospital systems that some hospitals are at capacity or on some days on diversion, and that we are at a critical and dangerous point of stress on the healthcare system. Have we been too polite in asking for help? Are we not being loud enough? People are being doubled up in ICU rooms that are meant for one patient, and nurses are caring for multiple critical patients at once when the patients are really sick enough for one-to-one care. And we wonder, what is the end point? What is the stop date? These trends are going to continue if we just do nothing, if we don't do something different. When will people start to believe us and help out? Please think seriously about rationed care and how awful that would be. Rationed care means we have to reserve ICU beds for only those patients who meet certain age criteria and certain risk criteria, the ones who are more likely to survive. It is awful for everyone involved. If we don't do something to change the course, if we keep turning a blind eye, that is where we are headed. I'm a veteran. I wonder if we have veterans in the room. You guys support veterans? You guys support our troops? Who supports the troops? Okay? We are at war with this virus. It's on our soil, it's in our backyards. Our fellow citizens are losing their lives. Your frontline workers, the infantry, the folks in the trenches, your healthcare workers, they are at the very front edge of the battle. And the enemy is upon them, and it's overwhelming them, and they are calling for help. Okay, they're on the radios calling in for air support and ground support, which means they're calling for their community to help them interrupt the spread of the virus by wearing a mask. Will you support your troops and answer their calls for backup? By the way, we're also calling for logistical support and comm support, and that means more action from our community leaders, our elected officials. We need everyone, the community, the politicians, the business leaders, everyone to help. Even when it seems like it might be hard to wear a mask, hard to cancel an event, hard to implement a policy, hard to enforce something. Please answer our calls for backup. Please don't abandon us. If there was a raging fire in the city and your firefighters needed more trucks, would you pretend you didn't hear the call? Or if there was a hostage situation at a school and the SWAT team was calling for backup, would you turn off the radio? So yes, you do have a personal choice here, personal freedoms. And your choice is this: will you choose to support your troops, or will you turn away and turn off the radio because it's too hard? That's your choice. Thank you.
Thank you, Shannon. Good evening.
Evening. My name is Nick Weiland. I'm a Sioux Falls resident and also a partner in a business just across the street there. I'm here to express my concerns regarding COVID-19 within our city and our state. I believe we are past the point of no return in this fight against COVID. We've asked people to put a mask on, and they obviously haven't done it on their own accord. The least we can do is a mask mandate. As some of you have mentioned, this should not be a political matter. Currently, the Surgeon General of the United States of America is in our state due to the lack of control over this virus. I understand the concerns in voting for the mandate. However, as leaders and elected officials, we hired you to protect us, and right now I sincerely feel like this is not happening in our city. I believe this is less about taking freedoms away and more about caring and protecting our most vulnerable. Our institutions, like our educational systems, healthcare, and local businesses, are in jeopardy. You cannot have a booming local economy with sick people in it. Without getting into the science, we simply do not know the future impacts of this virus or the costs associated with it. What we do know, though, is that masks can save lives. That's why the healthcare system in our communities partnered with the city to request that all of us mask up. It is truly not that hard of a thing to do. Currently, we are at a point in hospitalizations and infection rates that no professional would deem acceptable. Months ago, during multiple press conferences, we were told to watch hospitalization and infection rates. And I am sure that I do not need to remind anyone in this room where those key indicators are currently. But it is looking more and more like a worst-case scenario. With overworked and overcrowded hospitals, an economy that is crippled by the failures of our elected leaders, especially at the state level, to listen to science and not politics, I feel like we found ourselves in a great crisis that demands action. Please put down the political divisiveness and disregard for what our scientists and doctors are saying and help solve the problem at hand. In my opinion, and I think in a lot of doctors' opinions, their professional opinion, that starts with a mandate to wear a mask in public. We are asking you to act. Thank you for your time and consideration.
All right, thanks, Nick. Good evening.
Good evening. Jennifer McKay. First, I just want to say thank you to all of you for your leadership and service to Sioux Falls. Right now, there's a rising number of COVID cases and hospitalizations in our city, which demonstrates that we have community spread. Myself and my colleagues that I work with are feeling overwhelmed and voiceless. Tensions are high, and many nurses, doctors, teachers, and city employees are being stretched thin. As a city, we aren't flattening anything. Nothing is improving because of the lack of consistency with using the protocols in place. Those who are doing their part are also the ones who are impacted by those that are not doing it. With holidays approaching, people who are social distancing and not planning to attend family gatherings, again, are the ones that will be impacted by the ones who are traveling out of state, not wearing masks, or gathering with others. I have personally decided not to travel out of state to see my family for Thanksgiving. I know it is my choice, but when I see and hear others freely going out of state or gathering with others, it makes my efforts and sacrifice null. Same with masks. If I go to Hy-Vee, I have my mask on. This past weekend, I walked past numerous people unmasked. My efforts for the community seem null because of the few who can't or won't wear a mask, a gaiter, shield, or any other face covering. This mandate needs to start an action in our city. My daughter was invited to a birthday party. All I said was, we haven't gone to one since COVID started. Her response was, I'll just tell them I can't go. No tears, just understanding. But again, I feel like her efforts will seem null. It seems like no one wants to enforce a mask mandate or consider a lockdown quarantine, but leadership is sometimes making the hard decisions for the betterment of all, not just a few. Many of my colleagues and I would like to see more proactive measures being taken rather than continuously waiting as numbers continue to rise. I don't want to be a number or a COVID statistic. In my experience, it seems like it takes people getting COVID or a close friend or family member to get it, to take it seriously. By then, it's too late. Haven't enough people died or been hospitalized for our city to take action? Please vote yes on this mandate. Be ready for numbers to increase if we don't. Please be proactive. Thank you for your time.
Thanks, Jennifer. Good evening.
Good evening. My name is Heather Krause, a resident of Sioux Falls. I also want to extend gratitude to all of you. It's been a long night. I should not have worn heels. I will learn to do better next time. But you've been very engaged. You've all looked at everybody and listened to them. And I think democracy is in action tonight. And it's great to be here and partake in it. So thank you very much. I would first like to read my testimony. And then I will go ahead and share some slides that have previously been shared with you via email. Good evening, council members and Mayor Ten Hankin. I'm here tonight to speak in support of the mask mandate for the city of Sioux Falls. As a market research manager for Sanford Health, and I will qualify that I'm here on my own accord as a citizen and not as a member of Sanford Health, I dedicate my time and efforts to analyzing data and providing strategic insight based on unbiased data, leaving my opinions aside. Using data to make and support decisions is essential in leadership, especially when outcomes of decisions impact hundreds of thousands in our community. So while I could stand up here and tell you about the mental health struggles and anxiety attacks that I have personally suffered as a result of COVID-19, resulting in therapy and increased medication, Or I could share the story of my healthy, active 40-year-old brother who suffered tachycardia as a side effect of COVID-19, causing his heart to stop and be restarted while he was awake. Or I could share the intimate trauma of my mom being diagnosed with stage 4 ovarian cancer this April, and having her experience surgery, chemotherapy, and recovery in complete isolation. But instead, I will focus on the data. On Monday, I shared a full presentation breaking out Brookings County as a case study. I hope you took the time to read it, but I do have it here this evening. Brookings County has proven that taking the hard steps to mandate masks and control the pandemic works. They cannot do it alone. On Monday, immediately following the mask mandate ordinance, Brookings County saw a drastic decrease in COVID cases in the week and a half that were following. To this day, Brookings County's positivity rate is half that of Minnehaha and Lincoln County. They continue to have the lowest number of cases per population and the third lowest number of cases per population size among the 10 counties with the largest cities. Additionally, their 14-day rate shows steady or decreasing cases compared to nearby counties, including Minnehaha. The graph that you see there is showing where that mask mandate on September 8th, that ordinance was passed. You will see an immediate decline in their daily cases. This had a massive impact. In talking to the city manager, Paul Brazeno of Brookings, he indicated that this was essential for their community. It provided them time. That is what we need right now. It is time. We need to provide our healthcare workers time. They need to recover from too many beds, too many patients, and not enough staff. Yes, our hospital systems have enough beds. They don't have enough nurses to staff them. We are in a major shortage. We are bringing in nurses from outside of our community to care for patients. They are tired. And while we can stand up here and celebrate them, as we should, for the hard work that they've put in, we should celebrate them by doing what we can in our community to help relieve the stress of what they are experiencing every day. Go to the next slide, please. I will note that obviously I'm about data, so I'm not going to deny that, of course, Brookings did see another increase. In talking to the city manager, they really believe that a lot of that is due to the massive increase that happened as a state. Also, Brookings in particular, 57% of their employees commute from outside of the city. For the people that live in Sioux Falls, that's not necessarily the case. We have way fewer commuters, and we know that if we mandate a mask, people will do that when they come in. Next slide, please. A final consideration, if you look at the positivity test rates from Brookings compared to Minnehaha and Lincoln, it is double in our communities. So while cases may go up and down in communities, that positive test rate and mask mandates have a major impact. Brookings has shown that there is a way to slow the spread, ease the strain on our hospitals, and provide relief in a community in crisis. The death rate alone in our state should make all of us eager to do something. In the worst year of influenza, between 2010 and 2020, we saw 73 deaths in 2017. In the last 22 days, when I pulled this data on Monday, we've seen 222 deaths due to COVID in the state of South Dakota. It is time we think differently about our strategy. It is time we read the data and take politics out of our policy and let us unite in a proven strategy to slow the spread so that we can not only ease the strain on our hospitals, but create a safer community where we can all maintain a semblance of quality in our lives, regardless of our age or pre-existing conditions.
Thanks, Heather.
I apologize that I went over.
Thank you. Good evening, sir. Clock's going, man. Let's go. All right, you ready?
Yeah. Good evening. My name is Fernando Bularudas. I am a board-certified pediatric infectious diseases specialist here in Sioux Falls, and I am representing myself. To the members of the council, to Mayor Paul Tenhagen, and to fellow citizens of Sioux Falls, I want to speak today. Our city is experiencing record high hospital admissions by COVID-19, all product of a substantial widespread of the virus in our city, in our state, and in our country. Our neighbor states and communities are experiencing similar infection rates. Our healthcare workers continue to be impacted as well. We are tired. I am overwhelmed. I am tired. These numbers that we're seeing today are a reflection of what the infection has been transmitted for the past couple of weeks. These rates of infection will not start going down if no action is taken. I have seen patients, I have seen children, I have seen newborns in the hospital admitted with COVID-19. I have seen healthy teenagers, athletes with possible heart problems because of this virus. We need to act. We need to act now. Every day, allowing the status quo will continue to deliver more and more people infected and affected. We have learned about the long-term consequences of this virus, even in healthy individuals that present with mild symptoms. We need to help protect our community. We need to protect all vulnerable people. Pregnant women are more likely to have miscarriages, are more likely to have complications. We need to protect those who cannot wear a mask. It is a valid medical reason. I see children with immune deficiencies. Most of them, below the age of 5 years old, they cannot wear a mask. Their parents are anxious. Masks are effective in stopping the spread of the virus from people who do not present with symptoms. I am asking you this evening, I am a father, I have a 3-month-old daughter that I do not take, or I'm not able to take anywhere in town because I do not feel safe taking her, because I do not feel protected. So I am asking you this evening, in the name of science, in the name of evidence, I am an expert in infectious diseases, to set a mandate for wearing a mask in our city to help protect those who are vulnerable, to protect all our community, and to protect those who are not able to wear a mask. Thank you.
Thanks, Fernando. Good evening.
Good evening. My name is Jacob Kranz, born and raised Sioux Falls resident. Thank you, Mayor and Council, for hearing me today. I wanted to present an argument that I don't think has been given a lot of consideration about how masks can actually be good for some businesses. Particularly what I'm thinking of is retail. I worked at the mall for many years, and the mall is a big place. I worked there on Black Fridays, and right now we are less than 3 weeks away from Black Friday. A lot of brick and mortar retailers, they live and die based on the holidays. And Sioux Falls is a hub city. We draw in a lot of traffic from out of town. A lot of people come here to go shopping. And the people that come here to go shopping, they visit the restaurants, they stay at the hotels here. I think it brings in a lot of revenue. I'm worried that there might be more people out there like me who refrain from going to crowded areas because there are a lot of people not wearing masks. It's a lot easier to go into a place for someone like me who has concerns about the virus if I know that they require masks. And I'm just worried that that might in some way hinder business. You know, brick and mortar retailers have been struggling for a long time before COVID happened. They're being cut out from underneath by internet retailers like Amazon. Now I realize that the city can recoup some of that lost sales tax through new sales tax from companies like Amazon, but we can't reduce the lost property tax that we're gonna lose if they close down. You know, the county gets the majority of its tax revenue from property tax, and when brick and mortar stores close and sales shift online, all you get is the sales tax. There's no property tax. So I feel like a mask is the least intrusive thing we can do to make people feel safe shopping in large crowds, which I'm hopeful will be large this Black Friday, despite everything that's happening. Also, the main criticism of this ordinance that I've heard is that it's difficult to enforce, or would be difficult to enforce. Personally, I feel like that's not an excuse to abandon an ordinance. It may well be difficult or even impossible to enforce, but it still sets an example. Just by making it so, it will encourage people to wear masks. I'm sure everyone that litters in this city doesn't get a ticket. Everyone that doesn't wear their seatbelt doesn't get a ticket, but it encourages people to, that it's the law. And there's benefit to that. I don't imagine people are going to be calling police every time they see someone without a mask on, but at least they'll be encouraged that it's the way things are in this city. I don't expect there'll be a lot of punishment there, but just saying that we're not going to do something because it's difficult or challenging is in my opinion, that's just a non-starter excuse. I'm pretty sure that if any of you ran on a campaign platform saying that whenever I'm faced with something that's difficult or challenging, I'm just not going to do it, you might not have been elected. I'm going to beat a dead horse here, but Kennedy said we do things not because they're easy, but because they're difficult. And I feel like this could realistically help retail sales in the shopping malls in Sioux Falls, especially over the holidays. One last thing I just want to touch on is that I've been really proud of the leadership here in Sioux Falls. I feel like we are kind of a beacon for our state in many ways. The state leadership seems to have taken somewhat of a laissez-faire, hands-off approach to the pandemic. And what I see is a leader who's leading by choosing to do nothing at all, or saying that that she trusts in the people to choose. Well, I live in a republic, not an anarchy. I expect my elected representatives to make some choices for me, especially when there's a crisis. If an elected leader turned to me in a crisis and said, well, what do you think I should do? I should say, well, first of all, you're fired. I would like someone with a little bit more competence to make a decision for me because I didn't run for the position you hold. So please make decisions on our behalf with all the information you have and we don't.
Thank you, Jacob. All right, we're a little north of an hour on the public input. We'll continue to hear the testimony of the folks who want to speak, but my ask would be, I'm not going to read them all back, but for a lot of the points. So if there's new points to make or things maybe this body hasn't heard, be sure to highlight those if you have them. So go ahead, ma'am. Can you say your name?
My name is Amy Billis. I live in Sioux Falls. I'm a business owner in the healthcare industry and a member of the American Naturopath Medical Association. And I've been serving the community for 9 years now. There are several critical factors with requiring masks in Sioux Falls. One is the ineffectiveness of masks. I quote Dr. Christopher's Herbal Legacy newsletter of June 3rd. There are no scientific studies promoting the efficiency of wearing masks to prevent viral infections. Dr. Russell Blaylock, board-certified neurosurgeon, references 17 studies, none of which conclude a relationship between mask use and protection against influenza infection. Viruses are so small that expecting a mask to block them is like expecting a chain link fence to keep out mosquitoes. It's not going to happen. A mask can stop viral sputum on its surface. However, the CO2 buildup limits oxygen inhalation. This creates a need for forceful inhalation, which will pull the virus through the mask directly into the nasal passages and lungs. It is well known that surgical masks and the N95 mask cause hypoxia and an increase in hypocapnia. In this environment, the immune system is impaired as this inhibits the CD4+ T lymphocytes involved in the first-line defense. In other words, you are more likely to be infected with a virus by wearing a mask. Okay? A July study from the CDC confirms this fact. It was shown that 14 days before the onset of their illness, 3.9% of those who got COVID never wore a mask, and 70% always wore a mask. Although the health issue is of grave importance, I state that there lies a much greater concern. that must be our focus. I present before you that this act of ordering the citizens of our city to wear masks goes against our Constitution and is in a direct violation of our civil liberties. I declare that forcing us to wear masks is in violation of Amendments 4 and 9 of the Constitution of the United States. The real issue is it right to take away the free choice of an individual for the perceived benefit of the majority? This is what our forefathers fought against, and this is precisely what our Constitution prohibits. In 1997, Sheriff Richard Mack, along with 6 other sheriffs, sued the federal government concerning the Bradley bill that Bill Clinton signed into law. It went to the Supreme Court and was found to be unconstitutional. Justice Scalia, which was residing at that time, made several references to the Constitution and our founding documents. He said, quote, "The Constitution protects us from our own best intentions. It divides powers among sovereigns and branches of governments precisely so that we may resist the temptation to concentrate power in one location as an expedient solution to the crisis of the day." End of quote. This means that it is precisely at a time like this, during a crisis, that our Constitution protects our basic human rights of life, liberty, and the pursuit of happiness. It is for this person that government, both local and federal, is instituted among men, as our Declaration of Independence states. I submit that our elected officials fulfill their purpose. Thank you.
Thank you, Amy. Good evening.
Good evening. Thank you, Mayor Tenhaken and council members. This has also been a discussion at home as an educator and a parent. Definitely been seeing a lot of things. I have a friend.
Can you state your name, ma'am?
I'm sorry?
Can you state your name?
Nikki McCormick.
Nikki, thank you.
And my friend Amy Bruner couldn't be here this evening, but I'm reading something that she put together, and I can kind of echo a lot of this. Same sentiments. She's asking that, and I am asking that you vote against the mandate for the city of, the mask mandate for city of Sioux Falls. As this bill is very poorly written and requirements are written in a ridiculous and overreaching manner. One, can we explain what the language means when it says where 6-foot social distancing cannot be achieved or maintained? We deal with this at school every day. As long as others stay out of my 6-foot radius, I would be in compliance with the mandate because many of us make a solid effort to social distance from others. Would I be held responsible for others' behavior? This would apply to spaces at Walmart, Hy-Vee, Midco, etc. But once someone else enters my space, then I am out of compliance with the mandate if I am not wearing a mask. How is this enforceable? And by the way, what is the legal definition of social distancing? 2, as the mandate is written, in accordance with the 6-foot rule as outlined above, a person would have to wear this mask while swimming laps at Midco and other indoor pools in Sioux Falls because you can't guarantee others will stay out of your 6-foot radius at all times. Our children would have to wear masks while swimming and playing at Midco. In addition to simply being ridiculous, if not impossible, for swimming laps, this mandate would take away income from Midco, which has already starved significantly of income during the early times in COVID. Midco belongs to the people and its financial stability as well as the financial stability of the city. It's important to the citizens, and maintaining steady income to Midco is important. By way of this mandate, you would essentially prohibit lap swimming, which is important to the physical health of many of our Sioux Falls citizens. Think of the financial health, our financial and health ramifications, not to mention impact on our children. Reprehensible. 3, the mandate as written would require each of us to wear a mask while running on the treadmill or other methods of working out at the gym. I know many people for whom this is not acceptable. Many of them will cancel gym memberships. What right do we have as a city to pummel those gyms and physical fitness businesses who have already suffered during this pandemic? 4, the mandate as written would require athletes, adults and children, to wear a cloth or paper face covering while practicing and playing their sports of choice, including things like marching band. which we do indoors and outdoors, basketball, volleyball, hockey, etc., this seems like a very negative challenge when added to activities with increased heart rate and increased respiratory rate. Aside from the discomfort, think about the financial ramifications to Sioux Falls' businesses. Many students, and we can say including our own, will not choose to play club sports. That is money right out of the pockets of entities like MB, Kairos, Flyers, etc. Those outlets have already suffered. And are we going to require a Stampede player to wear a face covering while they are at a practice, drill, or play? Will we require their opponents to do the same when they come from other cities? And will we require all athletes from all other cities who come to town for tournaments to wear a mask while they play? As the mandate is written, they would all have to, which will drive many athletes out of our city, and with them, the dollars that could have gone to restaurants, hotels, mall, downtown stores, etc. If we're going to pass a mandate for one group, we can't really leave out another, can we? This mandate will have to apply to all so as to not discriminate. 5. But when you look at this overall, you will have to enforce it in an all or nothing manner. You can't exempt one group over another. You can't give one group permission to be unmasked within 6 feet, but require another group to be masked within 6 feet. For instance, you can't rightfully allow basketball players to go without, but require churchgoers to wear the face covering. My guess, it would be discriminatory. Legal problems abound. I know several teachers and students who have anxiety. I myself and my older son suffer from asthma, and it was difficult on the marching band field, especially with the heat and humidity, to have to wear a mask every time his trombone was not up to his face. So as a mother, I'm saying bottom line, the city is undergoing a promotional campaign to encourage mask wearing, and mask wearing seems to be the norm in most places these days. This mandate is vague and fraught with potential for litigation. Passing it is not governmental leadership and effective application of the legal system, which are your primary responsibilities.
Thank you, Nikki.
You're welcome.
Good evening.
Stanger. Listening to a lot of these people, it almost sounds like choice. You have a choice to wear a mask if you want to. You have a business that you have a choice to make a mask mandate in your business. But the problem is, they're not really telling you that they want the city to make the mask mandate because when they put the mask mandate on themselves, they lose customers. I do not go into a business that gives me a mask mandate. I will go someplace else and I will do my business elsewhere. You put a mask mandate here, I will go to a small town and I will get my groceries. I will get my car fixed. I will do whatever I have to do to not have a mask mandate. Because you have choice. One thing I've never did to my children is to put fear in them. I have 2 kids. I do not put fear in my children. I always tell them to live today as their last day. Why do I say that? Because you never know if you're going to wake up tomorrow. It doesn't matter if you are the best person in shape or the worst person in shape. You don't know what's going to happen tomorrow morning. But you hope you wake up breathing. This mask mandate is not thought out. It's against the Constitution. We go against our governor because she's not doing enough. She also knows the Constitution of the United States, and she stands by that. Now, we have heard Dr. Fauci come out on TV. Oh, mask doesn't matter. He came on TV, never wore a mask. Everybody, no, masks don't do anything. Then they tell you to wash your hands, don't pick your nose, don't play with your eyeballs. But yet, does anybody really know? Today they came out on the news stating that it really isn't the masks that keeps the virus off from people. It's the 6-foot distancing. Who do you believe? Who do you even believe? Who do you trust? You got Democrats saying one thing, Republicans saying another thing. We say that this isn't a Democrat and Republican issue. Are you kidding me? You guys have to be fooling yourselves. This has to go the course.
People are going to die. We all know we're going to die. I was always told that when I was young. Get ready, you are going to die. You're not going to live until you're 300 years old. Some people live to 20. I know a gentleman that is 30 years old. He's fighting for his life. He needs a heart, 30 years old. And he's not overweight, and he's healthy. Do you think he planned on looking for a heart at 30? No. We got people dying on the interstate. Do you think they plan on getting in an accident and dying? No, they don't. It happens. That's life. But we can't live in fear because of one reason. We have people that I talk to every day. Well, we're not going to have Thanksgiving this year because we're afraid. Are you kidding me? Then they say they can't have Christmas either. The two most important holidays that people want to be together with family, and they're afraid to be together with their family? Better watch yourself. You might have to wipe your hand off. You touched your eye. But it's just a point. Nobody knows anything really about this. I went back in July, and I can even say it word for word. I told you people when it came up to this time of the year, things were going to spike. I can pull it right up. I told you guys, flat out. And it's spiking. Is a mask mandate gonna do it? No. And when Sierra comes up here and talks about our police officers, I've been there with her. Pettigrew neighborhood is bad. You should go there sometime. It is in the Central District. Whittier, I got jumped. It's Friday, getting out of my car. Whittier neighborhood's really a safe neighborhood too. Thank you.
All right, thank you. Before you start, ma'am, by show of hands, who else is still here to speak on this item? Just so I can kind of get a count. We got 1, 2. Are you in line, sir? There, you guys? Yeah? Okay. Council, just by...
Mr. Mayor, I would move to extend time for public input on this issue till everyone who's here has a chance to express themselves.
Okay. And that was going to be my thought, but I assume the rest of the council's in agreement on that as well, just by looking at the heads bobbing. So we'll continue to proceed with public input. But again, my ask would be, and I think for them too, I'm not going to read all the pros and cons. It's a big list. So if you have some new points to make, we'd sure appreciate those tonight. So go ahead, ma'am.
Hi, my name is Cassandra Schumacher. The harsh reality of life is that people die. We will each die one day, some by cancer, some in our sleep, some by complications from the flu or another illness, some in an accident at home or in the car. There's only so much we can do to prolong our life, but we can do something about how we live our life. We can either choose to live in fear, hoping not to encounter germs, or we can live life to its fullest, going about our daily activities and enjoying time with family and friends, cherishing each day we have been given. We can lull ourselves into a feeling of safety by covering our face with a piece of fabric, or we can be diligent to wash our hands, sneeze into our elbows, stay home if we are knowingly sick, and otherwise go about our day. We can view everyone around us with suspicion for fear of the potential sickness they may have or may harbor in their body, or we can enjoy their company and offer one another relationship and fellowship because we need it, because without it we have only suspicion and fear and division. If some choose to wear a mask, then they have that choice, and if some choose not to wear a mask, then they have that choice. That's the beauty of America and the rights we hold so dear. We can live together in union and harmony, each expressing and living out his conscientious beliefs because we have that freedom under our Constitution. But we can only do that now and in perpetuity if we leave that choice with the people. To quote Mayor Paul in his November 6th blog post, quote, "We need leaders across the community, from our business community to pastors to teachers to retirees, to help us find unity again. We need to be reminded that we are much more alike than unalike. We need to not let fear and anxiety create dialogue chasms that can become uncrossable. So what do? I suggest we do what Sioux Falls does so well when times get tough. We listen, we unite as one Sioux Falls, and we respect one another," end quote. Listening to one another and respecting one another begins in this room today by respecting the people of this city to make the choice to wear a mask or not. Not letting fear and anxiety create dialogue chasms begins in this room today by not taking advantage of a tenuous situation. The virus has been in play since early 2020, over 8 months ago. The emergent nature of COVID-19 has passed. To claim an emergency ordinance is to misconstrue the nature of the situation and to take advantage of fear-mongering. And many are already choosing to wear masks. And for those that do not choose to wear masks, we can respect and honor their choice because it is theirs to make. We can only have the room for truly listening and uniting as one if we also have the room to freely express and live out our beliefs. Because what unites us is our freedom to hold wildly different political, religious, and cultural beliefs, and yet to live with one another with respect and space to express ourselves freely without fear of reprisal. There is a cost to freedom, and at times that cost has been high. In this case, the cost is merely courage and conviction to stand firm and protect the people from a mask order, which infringes on our freedoms, which takes advantage of fear-mongering, which disrespects each of us as individuals with varying political, religious, conscientious beliefs. People currently have the choice to wear a mask or not. Let us continue to make that choice based on our convictions, needs, and beliefs. As our elected officials sworn to uphold the Constitution and to protect our freedoms, please be courageous. Please stand firmly on the side of freedom. Please vote against the mask order.
All right, thanks, Cassandra. Good evening, sir.
Well, good evening, Mayor and councils as well. My name is Tyler Bonage, and I was here last week to contest the mask mandate. My angle of approach at that time was more analytic. Unfortunately, brevity is one of my greatest enemies, so I wasn't able to complete my initial speech. But I want to summarize it now briefly. I'm going to make an attempt to redeem myself there. I don't believe that masks are efficacious towards mitigating the spread of COVID-19. That is my conviction. I established that from the outset of the pandemic, Dr. Fauci and the New England Journal of Medicine went on record saying that masks don't work. And then my question then was, when was the pivot when they said that? When was the pivot and what data was used to support that? Now I want to quickly go to what my conclusion was at the time, but I never got to, which I thought was very important. So legislating a mask mandate wouldn't achieve its alleged desired outcome. I'd like to quote Johan Geisig, who is the chief scientist of the European Center for Disease Prevention and Control. He's one of the scientific voices of Sweden. Sweden, by comparison, is like the state of Michigan in terms of populace. They had not only flattened their curve, but also they never issued a mask mandate and have avoided total shutdowns. And Dr. Geisig recommends 3 pillars. He says to wash hands, social distance, and trust people. And now to kind of bring in for this evening what I wanted to add to that. Although I do desire that this mandate fails to pass this evening, I don't want your passion to be quenched as a result. I particularly think of Star and Sale. I don't want your passions to be quenched as a result if that's the case. Your passion for public health and compassion for the citizens of Sioux Falls is not only noted and I appreciate, but I hope it's reoriented towards more successful means than what is being proposed today. I want to conclude with the Great Barrington Declaration. I would encourage you all to look that up. I'm sure you're enamored by so many recommendations, but this document was put together by Drs. Martin Kulldorff of Harvard, who is a professor of medicine, biostatistician, and epidemiologist, Sunatra Gupta of Oxford, who is an epidemiologist with expertise in immunology and vaccine development, and Jay Bhattacharya of Stanford, who is an epidemiologist and public health expert. Together, they formulated this declaration, which has over 11,000 signatures from medical and public health scientists alone, along with 34,000 medical practitioners. And in this document has information that ought to inform any public policy that would come out of this council at any time. They do not mention any mask mandating. They do also allude to they are against lockdowns, but I know that's not the context here this evening. So as I encourage you to read it, and again, just for reiteration's sake, and those behind me, it's called the Great Barrington Declaration. I want to close with this excerpt from the Declaration itself, and they say the most compassionate approach that balances the risks and benefits of reaching herd immunity is to allow those who are at minimal risk of death to live their lives normally, to build up immunity to the virus through natural infection, while better protecting those who are high risk. We call this focused protection. And I would like to note, for emphasis, to if you want to take a gander at it, that they do actually outlay practically what that means in steps of how to, maybe if you want to regather again and consider maybe a different kind of mandate or at least suggestion, or later on it looks like you want to put money towards the COVID fund for better education, and I think that that could help inform that as well. And so that's actually surprisingly, I beat it in under time and I impressed myself. So I'm actually going to conclude. So thank you very much.
Thanks, Tyler. Good evening.
Good evening again. I'm David Sokaitis, and I have a few comments here about COVID and masks. Not a long discourse. It's pretty short here tonight. All right. So we've got this great disaster at our door, and everybody's really worried about it. Well, but how big of a problem is it really? Nobody really wants to put this problem in context with a different problem that actually kills far more people. And that bigger problem is unhealthy lifestyle. If we don't take care of our bodies, if we don't get exercise, if we eat too much sugar and too much white flour and smoke, you die. That's just what happens. So I tried to look at the magnitude of this problem with data from a couple of years ago, and roughly 3 million people will die every year in the States, and a couple 100,000 are going to die from COVID. Well, the majority of the people that will die are going to die from unhealthy lifestyle. So we really should be focusing more on that and less on this, because that's where everybody's dying from. But with regard to COVID, we need some more evidence. We need some more science. I've heard people come up here and say, yes, the science shows that you need a mask, and somebody else comes up and says, no, the science says that a mask is not to your benefit. Well, if you're going to go through all the trouble of putting a mask mandate together, you should really get your literature search solid. You should have a scientific understanding and statement, and I haven't seen that. I mean, Councilor Soul didn't give us a list of scientific references, and the opposing parties haven't given us any scientific references. So I don't see how you can even make a decent decision without going through and doing a proper literature search. I haven't done one because I don't really have the time for it right now, but I would think that understanding the science behind the epidemic and how to mitigate it would be fundamental, and certainly a prerequisite for any mask mandate, because you don't even know if it works just yet.
All right, thank you, David. Good evening, sir.
Good evening. My name is Chris Dugard. I'm a resident here of Sioux Falls. I appreciate the opportunity to provide some input tonight. I'd like to thank each of you for committing your time, a lot of time, especially tonight, and energy to serve the citizens of Sioux Falls. Being a public servant is often a difficult, thankless, lonely job, and we're fortunate that each of you serve. Tonight, I think we have an opportunity to make positive change during this incredibly challenging time, and I'd like to make 3 quick points. First, we need to slow the spread of the virus. More than 500 people have died statewide, 157 of whom lived in the Sioux Falls area. More than 600 are currently hospitalized statewide, with over 200 of them here in Sioux Falls. Our hospital systems have made heroic efforts to expand hospital and ICU beds, but we're running out of staff. We need to slow the spread now, or we risk overwhelming our world-class health systems in the very near future. A mask mandate would increase mask wearing, even if it isn't perfectly complied with, which I think we all know it won't be, but it would help to slow the spread, which we direly need. Second, I ask each of you, if not a mask mandate, what's our alternative? Business shutdowns impose real costs and hardships. We do not want to go back there. and this ordinance keeps businesses open and operating. Doing nothing, letting the virus run its course, killing many more Sioux Falls residents, and overwhelming our healthcare workers is also not an option. If we're not willing to take this step, please tell us what we should do instead. Simply asking people to mask up is clearly not working, so we need a different approach. And without clear alternatives, this is the best approach. Finally, good policymaking often comes down to weighing costs and benefits. The cost here is that individuals entering businesses and public buildings will generally be required to wear a mask. That is inconvenient, to be sure. But the council has allowed for exceptions. They've allowed for those situations where one should reasonably be able to abstain from that requirement. And medical professionals across our city don a mask and take up this fight all day and every day. The benefits are that businesses can stay open. The transmission of a deadly disease will be reduced, again, even if compliance isn't 100%. Meaning that the number hospitalized will also be reduced and lives will be saved. By voting for this ordinance, we are saying that the benefit of saving vulnerable lives in our community is greater than the cost of the inconvenience of wearing a mask. Let's rise above this mess and tell those vulnerable in our community that we think that they are worth the inconvenience. City council members are rarely asked to vote on measures with such urgency that could save lives this directly. Please stand up for the lives of the vulnerable in our city, and I ask you to support this ordinance. Thank you.
Thank you, Chris. Good evening, sir.
Good evening, Mr. Mayor, City Council, Jeff Griffin, President of the Greater Sioux Falls Chamber of Commerce and Sioux Falls resident. Thank you guys for your service. I know everybody's been working hard on this issue. And just want to remind everyone, the Chamber of Commerce proactively supports the use of face masks. As I told you last week, we joined with over 40 South Dakota organizations 2 weeks ago to encourage South Dakotans to follow the CDC guidelines, the Masked Up South Dakota campaign, which is led by the state's medical community. Its purpose is to educate and work together and ask South Dakotans to do what they can to make a difference in their communities. The Mask Up SODAC campaign is not seeking a government mandate, nor is it endorsing criminal penalties for those who do not follow the guidelines. Education being the key to spread. We applaud the efforts of Councilmember Sale and Brecky to fund a public health education campaign with $120,000 in items 16 and 18 on tonight's agenda. And there are two key differences between the ordinance before you tonight and the Mask Up campaign and education. First, the ordinance seeks to impose a government mask mandate with penalties found in City Ordinance 10.999. The ordinance states the penalties include up to a $500 fine or 30 days in jail, and a violation would impose a misdemeanor on an individual's record for those who are 6 years and older and are located within the city's Sioux Falls limits with few exceptions. Second, should the ordinance pass tonight, there are numerous questions of enforceability. The Chamber's position to oppose this ordinance was not decided upon lightly by the Board of Directors. The Chamber gathered input from our membership, but also engaged in discussions with City Council members and the city's attorney over the past 2 weeks. Serious concerns were raised about the impact to businesses should the mask mandate be passed. Moreover, the lack of clarity about enforcement and penalties as to whether the business community would be required to report a violation remain unclear. Ultimately, the ambiguity of the ordinance's responsibility on business owners, along with the penalty up to $500 and 30 days in jail, were key reasons the boards decided to oppose the ordinance as it's presently written. Again, we strongly encourage our businesses to implement CDC recommendations in their workplace, and we're striving to create a list of members and businesses in general who will comply with that so that shoppers and folks can feel more confident going to those. It'd be a voluntary pledge. And with all respect to Councilor Sale, saying it can be a $50 fine compared with the law 10.999, I don't know if you have the authority to do that. And I appreciate, I saw, and you mentioned earlier there was an amendment. We haven't seen the amendment yet, but I think just the mere fact they're already finding additions, or you mentioned the word, it's common sense. Unfortunately, an ordinance needs built on more than just common sense. I wish it were that simple, right? But I think by some of the comments you're hearing tonight, I could imagine a situation where people are coming in and baiting for a ticket. And then if we're in a position where we're unable to prosecute or enforce that, then we're taken away from where we need to be putting our energy, which is uniting the community and the education campaign and praising the businesses that are complying with the mask mandate. This is a wonderful community, and I'd hate for this to be a distraction if it's unable to be enforced or if there are unforeseen consequences to our businesses. No matter how the vote goes, I know you all are doing the best you can for our community, and I sincerely appreciate that. But I would like some clarification, please, of how the vote will go with the amendment. I tried to look it up earlier, and the website was down, so thank you.
All right, thank you, Jeff. Good evening, sir.
Hi there. Jeff Oltoff, resident of Sioux Falls. For my purpose is that, like I say, I put my trust in God in everything that we do. And with that in mind, when I put on a mask, it's like I do struggle with it. I can't put a mask on, but if I have to walk from here to there, I can go like this and hurry up and get through from point A to point B if I have to. The other thing is that already, as I've sent emails to all of you guys about this, is that in the last 3 days or so, my wife and granddaughter, just the idea, we've been going to all these stores, they've already been insulted because they didn't have a mask on. They've been threatened to be kicked out of the store. Yesterday, I think it was yesterday, I was in a store and these are stores that we've been in. And I walked in there and they says, you have to wear a mask. And I said, I can't, medical reason. And due to the HIPAA, they don't need to know why. They wanted to kick me out of the store, but I had to do business there. And they said, well, do it online. Well, I don't do things online. We just don't do that. We had identity theft one time, so we stay away from it as much as possible. And the other thing is that if you were to put this into mandate, that you say that if you have a medical reason, they can't enforce it. But they're already enforcing it for us not to be able to go into the stores. You have Menards, Costco's, we quit going to those stores. And as mentioned earlier, I said, because the fact is the more we're told that we can't go into a store, other people like myself, it's like maybe it's just a select few. We're gonna have to go out of town to find a place where we can do our normal shopping. Thanks.
Thanks, Jeff. Good evening.
Good evening. My name is Richard Lemos, a new resident to South Dakota. I'm very thankful that I had a chance to come from California to see how failed it was enforcing masks. But more importantly, the responsible businesses that did do that, it didn't help improve the numbers. We still had large turnouts of COVID. People were still dying and getting sick from it. So I'd love to just state the obvious. So once again, this isn't going to save my life if I contract it, because only 2 people came to this podium and did the right thing. One person was actually praised for it. Grab this, and what does it say? 90% cure rate for bacteria and viruses. Okay, that's beautiful. She did the right thing. The second person who did it was actually told to speed up. So he did the responsible thing. Wiped down the component out of consideration for his fellow man, also to use hand sanitizer for him too. But this isn't going to help me if I fight it. What does help is you have a good immune system. You don't do a couple of things. You do not drink alcohol. That's also going to affect your respiratory and immune system. Smoke. And we just recently had approval for marijuana to be passed. How is that going to help someone out with respiratory issues to battle against COVID? So, with the numbers that did help out with earlier in the battle for South Dakota, you had hydrochlorophyll that was used before June 5th, and now has been removed. And what happened with the numbers? Numbers have gone up. So the science needs to be looked at all angles. What's going to work when it comes to balance? What's going to help out is by helping to inform your community to do the right thing, because only 2 people actually did that when he came in front of them. Only one was praised, the other was penalized because he took too much time. So I appreciate the time that you extended for everyone to come out here and talk. If you do vote this into office, what's going through my head is the idea of recall. Because at no point you should take this strict mandate to like keep my hands tied if I choose to do the responsible thing, to go ahead and continue to use hand sanitizer, social distancing, as people are out here just waiting for the opportunity to talking to. How many people follow the social distancing? You had the opportunity to address three things: social distancing, using hand sanitizer, and cleaning the podium for your fellow man. That wasn't accomplished by any of you. So if you go out to this strict way to like hurt your citizens instead of actually informing them to do other things to help out, to fight against COVID, because we're not fighting against each other, we're fighting against a virus. How do we get in contact with it? With personal spread. We could be having this conversation, but if I was infected, I'm breathing into your personal space, you could have a kind of contact. We had the person who did do the right thing, the diseased, I forgot, I wasn't paying attention, but his title was a disease agent to combat that. He is wearing just a surgical mask. So does that help out to restrain, if you come in contact with anybody else who's sitting inside this area, to prevent yourself from getting it? And then when it comes to accountability for ourselves too, if we have a chance to really control what we do in our own personal life, when I go home, my responsibility should be keeping in mindset that I've encountered a toxic space, anything from my body, my hair, my person. One person already mentioned that. At that point, I should walk into my house having a detox area, clean, take off my clothes, do the proper wipe down, don't encounter any of my personal family who's been in a contained space, and go and clean off and come out. Those are some things that do help out. This mask though, I mean, it's just to give comfort for the citizens. I work for Costco Wholesale. From March 5th, looking at the posted state outside the doors of Costco, they've already implemented mask wearing. You can't force someone to wear it if they have medical reasons, so we don't push that on our members. But what we can do is to continue doing what we have been doing. We've been wiping down our public touch spaces within employee break rooms, and also too for our members when they encounter this. So other businesses are doing the responsible thing to help keep their community safe. But you shouldn't go out for a person's livelihood, because if you make this a mandatory thing, then they have to face the legal ramifications of having a misdemeanor on the record. What does that do for them in the future? All right, well, take care.
All right, thanks, Richard. Good evening.
Good evening. Mike Zitterich of Sioux Falls. Maybe I'm the last one. This is let's see. Maybe we're hitting this all the wrong way, aren't we? The mayor's the one setting the example here. He's doing a good job setting the example. We should be listening to the mayor. So do we really need a new ordinance? And the one thing I asked Kurt, this is your ordinance. How do you intend to force people to pay the fine? Or how do you want businesses to go out and turn their customers in and then get the police involved? It seems to me we're looking at this all the wrong way. We already have an ordinance on the books. Let the businesses police themselves. Let the mayor set the policy for the city, work together, and we should be working with the mayor and to establish that unity between the city and the businesses. Let the mayor work through his departments and create that policy that works best between the business and the city. You know, and I was doing some research earlier. I got looking, City Ordinance 131. Let the businesses please make their own policy in the name of keeping the peace. Utilize the police departments in that way. And that's the direction we should be taking. We don't need an ordinance to make people wear masks. People want to wear masks, they'll wear masks. I'm a small business owner. My dad's owned a business for 30 years. My brother just opened up his own business. We don't need any more ordinances. But what we should be doing is working with the mayor, Greg, Alex, Kurt, sit with the mayor and see what type of policies we can create to work with businesses, make it easy on the businesses and not some new ordinance. But thank you for thank you for your time to reach out and protect the citizens. But I think the citizens are actually doing a good job of policing themselves. That's really all I got. So I think the mayor's doing a good job, and I think we should be doing more to work with his leadership. I mean, this mandate would most likely go against what the mayor's saying. I mean, we don't want to publicly shame businesses or each other, and that's what you're asking the businesses to do, is turn in their customers anytime they violate their little policy, turn them in. And then you got the mayor saying, calm down, keep calm. And that's he's been saying the whole time, stay calm and stay united. So that's all I got to say.
Thanks, Mike. Good evening.
Bruce Danielson. I'm still wondering why we're here tonight, or why we're even talking about this, when all of you already know you're violating state law by not having the documents in the room last week. There are no documents over there now. Mr. Griffin was up here just a few minutes ago and said the website was down. I've had multiple text messages from people around the state already tonight during this meeting that the website's down. They can't see CityLink. Not only do you not give us the documents, you don't even set aside enough bandwidth that an elementary grade web designer would have planned for enough capacity so that the citizens of Sioux Falls could even see this discussion tonight. Why must we beg for documents that SDCL 127 1.16 requires you to have printed in the room? What is wrong with the messaging? Wear a frickin' mask. You know, we have an administration that likes to say dang and frickin' and about everything else. Why can't we have frickin' documents over here on the table where they're supposed to be? I have a philosophy in this, that if you care for others, you wear a mask. I'm wearing a mask. If you're in a situation where people aren't going to wear a mask, get the frick out of there. You know, what kind of leadership do we have in this room? On the one hand, our marketer in chief is doing PSAs to get everybody to wear a frickin' mask. And then we have advertising telling people to come here, take a COVID vacation in Sioux Falls. You don't have to wear a mask in Sioux Falls. Just come here and spend your money and leave your disease with us. You know, what do we care? That's what we're getting here. I heard a lot of really great discussion here tonight. Now, when you decide that you're going to get rid of public input on things, are these people going to be able to come here and do this from now on? You know, I just saw a councilman shake his head at it. You know, this summer, there was a meeting, and we got booted out of the meeting so they could go into executive session, so a couple of us went down to Falls Park. Falls Park was full of COVID vacationers from Minnesota and other places. And they were there because they didn't have to wear a mask. The one couple that we talked to was from Austin, Minnesota. They had to get out of Austin, Minnesota so that they could come here and play in the polluted Sioux River. My God, you people don't understand that it's the 13th most polluted river in the country, and they want to come here and bring COVID with them and then play in the river. It made no sense to me. I choose to respect my neighbor and wear a mask. I appreciate what you're doing and bringing this forward and bringing it up. Why the hell can't we have a proper process? I learned that none of you council members got to see any of these ordinances before the meeting last week. None of them got printed out, put in a book or anything out here. That is an open meetings violation, number 4. You're on a winning streak. Thank you.
All right, thank you. All right, any final public input on this topic tonight? All right, I'll take you two, will be the last 2 speakers tonight. You and then you, sir.
Stacey Fisher, Sioux Falls. I didn't plan to speak tonight, so I don't have something written down, and I'm not real eloquent. But I sat here and I listened to pseudoscience, fake doctors, and people who said that my immune-compromised sister should just die. My immune-compromised sister, who through no fault of her own, had a kidney transplant 6 years ago, should just die. Because some of these people refuse to wear a small piece of cloth that may help save her life. She has not left her house since March. Her partner has to work the night shift to avoid people. Their daughter has to be homeschooled. So for 6 months, we've tried the hope and pray. We've tried the do nothing. We've tried to ask nicely. I think it's time for us to do something so that maybe she can go out, so that maybe she can leave the house and feel safe, so that maybe she doesn't have to die at the age of 37 because some of these people don't want to wear a mask. For those who can't, I say you can do what the rest of us have done for the last 6 months. Order takeout, order curbside, avoid those places. Stay home, stay in your house like my sister has for 6 months. We don't get to have Thanksgiving this year, not because we're afraid. We don't get to have Christmas this year, not because we're afraid. Because if one of us contracts it and doesn't know, she could die. So when I hear everyone come up here and say, oh, it's your choice, all I hear is, I don't care if your sister dies. I don't care if my fellow Sioux Falls citizens die. I don't care about anybody else's health but my own. And if that's the kind of people that we are, selfish and only care about ourselves, then I guess we don't get a mandate.
All right, thank you, Stacy. Good evening.
Evening. My name is Steve Johnson. Is the CDC the only authority on infectious diseases? Is the CDC the only source of information on infectious diseases? People that demand masks only cite the CDC. There are other places, other sources of information, other authorities. Now, Mr. Sales says that the mask saves lives. Are you prophetic, or do you parrot what the CDC says? There are studies that say they don't save lives. The other thing is, even if they do, how do you project that into the future? Firefighters, lifeguards, teachers, average citizens save lives every day. That's provable. But when you say masks save lives, that is not provable. Not that I know of anyway. Mr. Sale touched his mask 42 times during his testimony. Is his mask clean? I don't think so. We're told that masks will flatten the curve and slow the spread of COVID. And if the cases go down, if the deaths go down, what do? Take the mask off? What is the magic number of cases or deaths that triggers restrictions or liberty? If we're so concerned about people's health, why don't we educate people, have some better lifestyles? We're selling tobacco, we're selling alcohol, and soon it'll be marijuana in this town. Those are all problems that are affecting people each and every day. They're all going to die. My parents, my grandparents, they all died of emphysema and other issues because they smoked. I've got relatives who died of alcoholism. Now, I've got 2 brothers that had COVID. They got sick. They survived. Their families, they didn't get anything. Why, I don't know. Instead of mask mandates, let's do something, let's think about other alternatives to mandating mask wearing. Don't project your fear of COVID and your feelings on the rest of us. Thank you.
All right, thank you, Steve. All right, that will wrap up our public input on this topic, it looks like. So now, I'd ask, let's get a motion on the floor, and then we'll move into the council discussion that we are going to have on this item.
Mr. Mayor, I move we move to approve.
All right.
Second, Brecky.
Second, Kylie.
All right, motion by Councilor Sale to approve and seconded by Councilor Kiley.
Mr. Mayor.
All right, we'll go into some discussion. Councilor Sale.
Yes, I'd like to go to Councilor Brecky at this time. I know she has an amendment. If we can work on that amendment, then I will project an amendment, and then we can debate the whole thing as one package.
Got it. Councilor Brecky, you want to introduce your amendment?
We received a communication earlier from our attorney about some concerns he had, and what I'm doing here in this amendment is just adding an invocation of our home rule powers to the proposal, so that it just opens up a second line of authority and thus a second line of defense should anybody challenge the authority of us to take this action. So I just added these whereas provisions that actually just invocate the fact that we are exercising not only our Title IX authority as a municipality, but also because we are a home rule municipality, we are invoking that authority as well. And so it's really just a kind of a technical thing, and it's just a protective thing as we exercise our authority.
All right. You just want to make a formal motion on that, and we'll get a second on it then?
Yes, do you want me to read?
I don't think you need to read it. Just make a motion that the verbiage on the screen and in the packets is adopted into the ordinance, I suppose.
I would move to approve the motion as is on the screen and is in our packet of information.
All right.
I second the motion to amend.
All right, so we got a motion by Councilor Brecky to amend as stated with the verbiage on the screen and online, and that's seconded by Councilor Sale. Any discussion on that, Council? All right, hearing none on that, let's take a vote on that, please.
Council members Jensen,
Yes.
Kiley,
Yeah.
Nitzert,
No.
Selberg,
Yes.
Sale,
Yes.
Starr,
Yes.
Brecky,
Yes.
Erickson.
Yes.
All right, so that passes 7-1, so we're at the main motion as amended. Councilor Sale, you have an amendment you want to introduce.
Yes, thank you, Mr. Mayor. A motion to amend Section 1 by replacing public place with retail business, facility with business, and striking city-owned facility. In Section 2, add "and" before indoor in the first sentence, and replace public places with retail businesses and city-owned facility. In the third sentence, strike "an individual" and add "an individual" in subsection A, and add the following subsections. And here's where we get into the meat. Individuals who are engaged in swimming or a team sport activity where the level of exertion makes it difficult to wear a face covering. Public safety workers actively engaged in public safety role, included but not limited to law enforcement personnel, firefighters, or emergency medical personnel in situations where wearing a face covering would seriously interfere in the performance of an individual's public safety responsibilities. G, any member of a group of persons who are in a public place together and live in the same household or are a party of 10 or less, so long as the group maintains continuous physical distance of at least 6 feet from all other persons not part of a household or party. And in section 3, replace for the period of a declared emergency as set forth in Executive Order 218 with until January 1st, 2021.
All right, we have a second for those changes from Councilor Sale, or that amendment, I should say. Any second for that?
Second.
All right.
Kylie.
All right, Councilor Starr jumped in on that, and he'll get the second there. Discussion on that, Councilor Sale?
Yes, and what we've tried to do with this is to take what we started with last week, take some of the input that we've heard from people, such as exempting sporting activities where level of exertion makes it difficult. We felt that that was the appropriate thing to do. A couple of little technicalities about striking an individual. Public safety workers, I think, go without explanation that they should be exempt. And any member of a group or persons in a public place together. So if you take your family and you want to go to the event center and go to a basketball game and you're together, your family does not have to socially distance or wear a mask from that party. They have to socially distance from the next party that's with them. So these are some cleanup languages that we put in. We believe it addresses some of the issues that people had along with that. So that's the gist of my amendment.
All right. Other discussion, council, on this amendment? All right, I'm not hearing any. So we can go ahead and take a vote on that amendment next, please.
Council members Jensen,
Yes.
Kiley,
Yes.
Nitzert,
No.
Selberg,
Yes.
Sale,
Yes.
Starr,
Yes.
Brecky,
Yes.
Erickson.
No.
All right, that failed, or excuse me, that passes 6-2. And so now we're back to the main motion as amended twice here. Any other amendments to introduce, or we want to go into no more amendments? We'll move into discussion then. Councilor Sale, floor is yours.
Thank you, Mr. Mayor. I'm going to make a few points on some of the testimony that was brought forth tonight. Certainly, I was very impressed with the review of how it's worked well in Brookings. The statistics show that a mask mandate reduces the number of COVID infections. Second, there was some discussion about how this was going to affect businesses. That's why we purposely did not include any occupancy limits in this ordinance. I believe, as long as many others do, that if we universally wear masks in the city, it will promote business. Those people that have brick and mortar businesses in the city are going to suffer from the people that don't want to go to their business because they're afraid to go if they don't have a mask on. So I know I can cite you examples right in my own household where now shopping has gone online instead of going to the stores. Now the city of Sioux Falls is still going to receive the sales tax because of the Wayfair decision. But those local businesses will not. And now through this time, this Christmas time, Black Friday, when these people make their money, it's very, very important for us to extend that and support all of our businesses to go along with that in a safe, thoughtful manner. That's all I have to add.
All right, thank you, Councilor Sale. Other discussion on the council on this? Councilor Brecky, go ahead.
Mr. Mayor.
I'll go to Councilor Brecky, and then I'll come to you, Councilor Kylie.
Actually, I'd like to hear what Councilor Kylie deferred.
Councilor Kylie, go ahead, and then we'll hear from Brecky next.
Well, thank you very much. I've been thinking about how fortunate we are, and I've mentioned this to many people, regardless of their position on this ordinance or proposed ordinance, how fortunate we are to live in a democracy that allows us to have this discussion that we have had this evening. I think, everybody involved. And for me, this is not about what others have or have not done. It's about what I can do, what I think we can do. So again, why propose a mask mandate? Number one, it's for the health and safety of our citizens. It's to relieve stress from our very stressed healthcare systems. It's to keep our businesses open and potentially bring in additional business. And not to mention to keep employees working. It's to keep our schools open. The impact on learning is tremendous if they have to close. The impact on our parents and the need for childcare is going to be tremendous if our schools have to close. The active cases and hospitalizations and deaths are setting all-time records. In fact, just in the days since our last meeting, Tuesday through today, we've had an additional 102 deaths in the state of South Dakota. Now, I don't know exactly how many of those are Minnehaha and Lincoln, but based on our statistics, that would be at least approximately 30 individuals from our Sioux Falls region who have passed away just in this past week. The longer we wait, the worse it's going to get. Our percent positive is well beyond where it should be. Okay, let's talk about studies a little bit. Studies have shown mask mandates are effective. Let's take one of our cities just to the north. Brookings percent positive is half of what ours is. And an interesting note, I spoke with the Brookings city manager this morning. An interesting point that he made is that their sales tax revenues are actually up 1% over last year. Tremendous considering what they're going through as well as what we're going through. So apparently the masks and the other mitigations that they have had in place and kept in place where we rescinded ours have not negatively impacted their businesses. Okay, we've already shown you in the previous PowerPoint presentation that the national stats show during, or that the mandated states have fewer cases than the states that are not under a mask mandate. One of the studies that I find the most interesting comes out of the University of Kansas. The study found that there's a 50% reduction in the spread of COVID-19 in the counties that had a mask mandate compared to those without. What's interesting in that, individual counties in the state of Kansas have the ability to opt out. Some did, some did not. So it set up the perfect scenario for doing an experimental group, control group type of study. And so I do believe that is very valid. None of us have ever said that the use of a mask is going to totally prevent COVID, but it has proven time and again that it can reduce the cases. I'd like to talk a little bit about enforcement. I have always envisioned this as being enforced with a smile and here's a mask type approach, have a nice day, versus handing out a citation and being heavy-handed. In fact, that's exactly how Brookings is enforcing their mask mandate. When I asked their city manager if to date they have had any issues with enforcement, his reply was none whatsoever. I want to repeat that because a lot has been made about enforcement. His reply was none whatsoever. So enforcing this ordinance should not be any different than enforcing our earlier no lingering ordinance or the enforcing the withdrawn shelter-in-place ordinance. Furthermore, we don't expect, I have never expected our businesses to be the mask police. They can deal with it as they do with an issue such as smoking in public places. It's up to them whether they place a call to the authorities. Unfortunately, it's been implied that because this falls under Ordinance 10.999 in terms of enforcement and penalty, that if a fine is not designated, that there isn't any discretion on what the fine would be, that it would be the $500 or the 30 days in jail. Well, our texting while driving ordinance falls under Ordinance 10.999, as well as I believe the majority of our ordinances. There's discretion, and that decision ultimately is made within the administration, either at the direction of the mayor or our city attorney's office. Our cases and our hospitalizations and the deaths are up exponentially. In fact, there's been, as I've mentioned earlier, 102 deaths statewide just since this past Tuesday. So we need to act now. This common sense ordinance allows us to better protect our community. Yes, it's true we can only control our 80 square miles, but implementing a mask mandate requires individuals from outside of our community to mask up, thus protecting the citizens of Sioux Falls. And again, very quickly, the ordinance in detail, face coverings are not required when a person is able to socially distance 6 feet, is under the age of 5, is seated at a public place to eat or drink, is receiving dental or medical care, or has medical or mental health conditions or disabilities that makes it unreasonable. And our clarification amendments that we have brought forward this past week do not need to social distance within a family or a group of friends. It exempts sports activities, and the ordinance also has a sunset of December 31st, 2020, which enables us to reevaluate this after the 60 days. So if not us, then who's going to do this? We can only control what happens within the boundaries of our city. If we want others to follow, then we need to lead by example. Tonight, and in the email that all of us seen, we've had medical professional after medical professional who are fighting this virus day after day, basically begging us to do something and to put in a mask mandate if it would only reduce their load, their duties in the hospital, even 5 to 10%, it would be 5 or 10% fewer cases that they would need to work with. They're extremely overburdened, and we've heard that they're understaffed. So I sincerely request my colleagues on the council to support this measure. We have the ability to reduce the spread of COVID-19. Please, please vote yes. Thank you.
Thank you. Councilor Brecky, go ahead.
I think I can be a little shorter because I think that was very eloquently stated. I don't think, and very comprehensive. I don't think a lot of what I would say would duplicate it, but I do want to duplicate it a little bit. As I look at this issue, for me, it has been an issue about public health. And I go back to when this crisis started, and we heard from our public health professionals regularly when we were trying to engage in mitigation efforts as we anticipated this surge. And when all that was going on, one of the doctors, and I don't remember which one, said very early on, at the earliest stages, this would have been in March, he made the comment, When you're in a crisis like this, he said, when you're in it, you're accused of doing too much. Afterwards, you're accused of not doing enough. And that stuck with me, and I've thought about that as every issue has come up, and I've had, to be faced with making a vote on it. I don't want to look back and say I didn't do enough and I could have saved more lives. And I believe that this is an issue that can save lives. And so I'm going back to that. That's been my mantra. That's been one of my rules that I've tried to live with as I've worked through this crisis. And I go back to, this is, as Councilmember Kiley said, a public health and safety issue. The World Health Organization is imploring cities around the world to take more assertive efforts now. The CDC has consistently said that wearing masks is recommended. We need to step up our mask wearing, and mandating it, I think, will allow us to do that. As you also see on the agenda, and what will be followed up, we will have a discussion about funding a positive message, which I think is extremely important, that it not only do we mandate it, but we implement it and execute it in a way that's positive and upbeat, in a team-building spirit that's done through the use of layered advertising and public education approach. So I'm already jumping ahead a little bit, but for me, these two go hand in glove together. And then a little bit about leadership. I also agree with Councilmember Kiley that this is the time when we need to step up and act like leaders. I think at this moment, we're a little behind. I think we've left it to the hospitals, and I was particularly moved by some of the comments tonight. One of the caregivers said, healthcare is shouldering all of the burden and all of the stress, and they're the ones that even let out in the Mask at South Dakota campaign. We are just leaving it all to them on their shoulders. And another thing that was particularly moving to me was the young woman who testified about this being like a military operation. And she said, listen to your doctors and nurses. We are at war with this virus. Will you support your troops? And that for me is, it's hard to be in a leadership position, but I am in agreement that this is an act of supporting our troops, not only, again, with the items that are going to follow this from a monetary standpoint and an education and advertising standpoint, but a legislative policy move that actually requires, requires the mandating of wearing of masks. And then finally, there was another statement, again, that I thought was particularly moving, and that's why I like to read these during times like this, because I like people to know I am listening. I'm allowing you to help me make my decision, and when I'm particularly moved, I like to use it, in my comments. And another statement was made that the medical officials are donning a mask and taking up the fight every day. Why aren't we looking at this like a cancer patient and we all shave our heads? Why aren't we shaving our heads in support of our medical community? Good Lord, what they're going through. Can you even imagine it? And it's close, that's the closest I've been to it, except that my daughter gave birth to a premature baby in the hospital when we closed down, and I had to deal with, the fear of having them in the hospital. And here's this medical community doing that every day. And I think that this is, absolutely a show of support in every facet of the way. I do believe that it's going to have an impact, because we are the unique city, because we are the largest, we have the densest population. So if we take action, it will have an exponential effect, and it will affect those outlying communities that come into our city, because they're going to be wearing masks when they go to the stores. I was also moved by the comments that businesses will not be hurt, they will be hurt if we don't, and that is where I am weighing in on that. And again, one of the testimonies said This is going to help our retail sales and shopping malls in the city. I believe that. I agree with that. I would hearken to my own family, just like Councilmember Sales said. They don't want to go out the malls if they know that this is going to be a mixed bag. If there's some wearing them and some not wearing them, why would we go out the malls? Why wouldn't we just all shop on Amazon? And so, you know, I believe that it's actually going to help our business climate if we do this. So those are the areas where I am kind of in parallel or in support of what my fellow council members have said. I do want to add something to the enforcement discussion. And I want to talk a little bit about how city ordinances are enforced and have been enforced for years. You know, I worked in the city when it had no code enforcement. And I think it's important from an education standpoint that you understand the difference between city ordinances and criminal law. City ordinances by law are actually called quasi-criminal. It's not even really a true criminal violation. Really how cities use ordinances is that what they're trying to do through ordinances generally are to take a collective approach and try to get a collective behavior, to work as a team with their community. And I can give you example after example after example. Pretty much everything we do, you know, watering your lawn, trimming your trees, shoveling the snow off the sidewalks. Every time we would pass an ordinance for years, when I've served with the city as the city attorney, there would be this debate about how are they going to force it. They're going to have a $500 fine if I don't shovel my sidewalk within 48 hours after a snowfall. And we never had a problem after we passed it because the enforcement practice is now, and I was thrilled to find that it was when I came back, you know, 30 years later, you know, that we're still what it's been, you know, what it was 40 years ago. We use it we get voluntary compliance because when we work as a team and people understand that it's important that the sidewalks be shoveled, we don't act like the Gestapo going out there and is immediately after that 48th hour start ticketing everybody. It's done discretionarily. It's done usually on a complaint-only basis, and it's usually done by citation. Well, it's almost always done by citation. They don't arrest people and haul them off. They usually do notices and warnings first, and the whole thing is usually done, and lots of times we add an education component in order to make it a team-building experience. Again, if we trim our trees, we have nice-looking boulevards. If we shovel our snow, you know, the only thing that's really criminal are like our traffic laws. Those are speeding. Those are like truly just a fine sort of situation. But it's, you know, our ordinances are forced by citations. And the fine, the $500 fine, in all of my years with the city, I don't think I ever got a $500 fine for anything. Maybe once for a really bad nuisance case and the guy was really ornery and the judge got really mad and threw the book at him. But, you know, even our nuisance things, you know, we have ordinances about, you know, brush in your yard and you can't have it in your yard. You know, all of those, you know, could have been, you know, forced like the Gestapo, but generally speaking, the city uses it to get a change in behavior, and it uses it in a way that we get something done collectively as a group. And that, again, is why I'm going to be asking for my fellow council support when we do when we do the funding proposal, because I think if we pass this and then put some funding behind a very positive, upbeat, team-building, spirited public advertising education campaign, you know, we can get the voluntary compliance that we're really asking for and that we're really after in this mandate. So I think the ordinance has been drafted very reasonably in a very compromising spirit. And for those that are afraid of the enforcement, it's never been the city's practice, and it certainly is not going to be its practice during this pandemic when everybody understands, you know, how strongly people feel about it. For those that don't want to wear the masks. So I hope that my fellow council members will give it serious consideration. I hope you, Mayor, will seriously consider the position you've taken and allow yourself to be moved by some of the testimony tonight and perhaps change the position that you have spoken about earlier. So that's all the comments I have at this time. Thank you.
Thank you. Councilor Selberg.
Thank you, Mr. Mayor. If I could start by asking Maybe a little easier to hear me with this. If I could maybe start by asking the city attorney, do we have a clear, what is the fine here that we're talking about?
Thank you. As adopted tonight, I can tell you that, Councilor Brecky, you're right, it is a quasi-criminal offense. It's a city ordinance violation. But as a result of that, our city falls within the 2nd Judicial Circuit here in Sioux Falls, and so our presiding judge sets forth a fine and bond schedule. And the most current one that I have in front of me is dated August of 2020. And it reads, for violations of City of Sioux Falls municipal ordinances that do not have similar or corresponding state statutes, the total amount the clerk magistrates are directed to charge is, and this is, it says here, $95 inclusive of fines and fees and surcharges. That was dated August of 2020. Since then, they've added $2.50 onto the surcharge. So the total amount of the fine is $97.50. $35 is the fine, $62.50 is a court cost. That would be done by a power of attorney citation. This does not qualify under our administrative citations because under 40.999 of our code, it lists what qualifies, and emergency ordinances are not codified in there. And so it had been our determination that this would qualify as a POA for $97.50. Now that would be discretionary and whatnot, but I'm just telling you that that would be a standard. A speeding ticket, for example, is $120. Right now, that's what a general ordinance violation is.
Thank you for that. Appreciate it. I would just say, first of all, it's great hearing all the public input again, and we've heard it through our emails and that too for the last couple of weeks. I'm sure it's the hundreds into the thousands, so thank you to those of you who reach out. And again, it's the same, I've said the same story throughout the whole COVID ordeal. You'll hear a great argument, very compelling on one side, and 10 minutes later, you'll hear an equally compelling, great argument on the other, and it's the same tonight. So I'd like to thank Councilor Sale and Kylie for having the courage to bring this forward. And it's not easy. It wasn't easy to do, and it's a discussion we need to have, and I certainly appreciate all your hard work on it, and I know we've all been having discussions for a couple of weeks, and it's a discussion we needed to have, need to have, whichever direction we go. Let me say that I believe in masks, I believe in distancing, I believe in all the CDC guidelines, I believe in if you're not feeling well, stay home, if you're uncomfortable going somewhere, don't. I mean, these are things that we have preached since day one. I think what we're doing here tonight is saying that again. I do believe a greater portion of Sioux Falls is wearing masks and doing their best. Today I was at a meeting, there were 10 people who showed up, they all had masks on. I went to a pretty popular store today, 80% of the people, I would say, give or take, had masks on. The grocery store I go to in my church, I pretty much overwhelmingly comply. So I think people are working on this, people are wearing masks. Does it need improvement? Of course, everything does. But I think what it comes down to for me in this whole thing is that if this proposal were in the form of a resolution, I'd be a little more apt to be on board. And I know we've had a little bit of a talk about this too, and the response to me in some of our talks has been, well, that doesn't go far enough. I can respect that, but what happens when we're going to make it and we're going to do it this way, we do get into the enforcement part. And to me, the enforcement issues which have been brought up are affected to everyone from law enforcement to business owners, and I think, it needs to be clarified more as far as enforcement and penalties. Now we're talking about the amount that it would be. And I can tell you for sure, some of the people that I'm hearing from that are against this they're not going to wear a mask. Now I'm not saying that's right, wrong, or whatever, but I'm getting comments all the time where we will not comply, this is unconstitutional. I'll serve time before I pay the fine. I mean, we've got people that are going to dig in on this. Now, does that make that right or wrong? I don't know. That's just, I can tell you it's there. So we are going to have some conflict. There's going to be some division. As far as this, well, a smile and hand them a mask kind of thing. Well, to me, if that's how we're going to go about it, why not the resolution part where we're not so fixated on the enforcement? and the fines and the policing and putting this on business owners, that type of thing. So what I'm getting at is that I fully support where you're going with it, and what we're trying to do is lead, show the people what we want them to do, but let's do it. I thought would be to go about it this route, and if this enforcement part isn't a big deal, well, then let's take it off and let's do it this way and lead that direction. That's my thought with it. So I do appreciate the conversation again, and I would tell people again in your emails, a lot of times I get a lot of the same messages. You need to lead, you need to be strong, and you need to make the tough decision. And I can tell you, I think we're all ready to do it up here, but I think generally people mean when they say that means support me, and if you don't, you haven't made the tough decision. And I can tell you for sure, whatever decision we make tonight, there'll be 500 emails tomorrow of angry people on the other side. So there is no easy way out, there is no easy decision. We have to take the facts as we have it, use our point, the best point we can here and make a decision from here. So I think there's some way to do this. I don't know that I'm in on the mandate portion of it. So hopefully that all makes sense. That's where I'm coming from at this point. Thank you.
Thanks, Counselor. Other discussion amongst the council?
Mayor.
Counselor Jansen.
Thank you, Mr. Mayor. I, like my colleague to the right of me, think that over the last 2 weeks we've had great discussion over a mask mandate. I think we're all for masks in South Dakota. Again, we've talked about it for the last 2 weeks. There's tons of studies that people have, proven masks work. Brookings case study, MIT, all of these different places. I strongly encourage each of you to wear a mask if you're able. I strongly encourage you to be 6 feet apart where you can be. I strongly encourage you to wash your hands, maybe more than once a day. I also believe that the week prior leading up to this mask mandate, there was a campaign that was led by our healthcare community, our mayor, our chamber, our business community, 40 different groups, and there's a campaign going on to mask up. Sioux Falls, if you want, the message is mask up. We encourage you to mask up. Now, the mandate part of it is where I have a difference of opinion on this legislation, and I really am grateful for Councilor Sale and Councilor Kiley for talking through different issues on this. They're true gentlemen, and I appreciate that. As we move forward, I'll vote against this and get 500 emails tomorrow, and I'll listen and respect those emails as we move forward. But I appreciate the conversation and encourage Sioux Falls and the state of South Dakota to mask up. It really helps. Thank you.
Thank you, Counselor. Other discussion on the council? Counselor Erickson, go ahead.
Thank you, Mr. Mayor. And thank you for everyone that has reached out via text, email, telephone. It really does mean a lot to have folks weighing in, regardless of what side of the issue you are on. I did find a lot of very unique emails, which I appreciated. Many of them were not just a form letter of the same thing over and over, but I found it very fascinating as well as for, every article that was sent, the next person that was on the opposite side of the issue also had contrary information. And so just as we've gone through this, I certainly support the use of masking up. I'm thankful for the Mask Up campaign as well as the PSAs that have been on the media lately, encouraging folks to mask up, social distance, use good hand hygiene. I know I'm going to sound like a broken record again, and I'm going to say it again because this has been my number one point. Just because we don't have a mask mandate does not mean people are not wearing a mask. Not too long ago, I was at the store getting some things for a rental property of mine, and there were 14 people in line, all socially distanced. 14. One person did not have a mask on, and she made it very clear to the entire area that, she said, "I'm sorry, I have triggers. I can't wear a mask." And I said, "You don't need to explain to me. That's fine." And I found it very interesting that when I am places, people are wearing their mask, and I'm grateful and I'm thankful for that. And so I'd continue to really just spread that message of masking up. I do not buy into this leadership is supporting it and only supporting it. If you don't vote for this, you want people to die. That's just not true. That's not fair, and it's just not true. Because I know each and every one of my colleagues don't want to see a life to die. There are so many reasons why we see people choosing unhealthy lifestyles in many different ways, and we don't want to see people lose lives. But I want to make sure that we understand just because we don't have a mask mandate does not mean that people are not wearing a mask. People are masking up, and we need to continue to stay diligent until we have that vaccine available for our healthcare workers and those essential employees, as well as our most vulnerable population. The component that we're not talking about this is that isolation, is that mental health, and how we can make sure that we are caring for others that are really struggling with not feeling like they have a lot of hope. Whether it's being in isolation in a nursing home, whether it's being in isolation because you're sick, or whether it's because you are so scared of this virus and the mental component it has on you, we've got to be getting people the help that they need and addressing those, because that is just as dangerous with mental health as this virus, in my opinion. We've got to be taking care of those that are working long hours and doing that. And so I encourage everyone, continue to mask up. And obviously, my support is not there for this, but I do support wearing a mask, just not for the mandate. And we've got to stay diligent. Thank you.
Thank you, Counselor. Other discussion amongst the council on this item? Guys, Counselor Starr.
Yes, thank you, Mr. Mayor. If I could, one of the questions, I guess I have to start at the beginning, and I too appreciate the comments that we've received this evening. I was waiting for fake news to come out of some mouths by the time we were done. We've done what we could to belittle our healthcare professionals. I was totally moved, Dr. McKay, Jenny talking about family members and the people that are there. But mostly it was Chris that said something about, if we don't do this, what should we do instead? So for me, we have to decide, do we have a problem first? And I guess my real question is, when I pulled up the numbers Saturday night, because we look at weekly numbers and they come out on Saturday, and I had a question for Director Franken, if she's available tonight.
Yeah, I believe she's on the phone. Go ahead.
Yes, I am.
Thank you, Director. One of the things that there were two things that when you look at the dashboard for the city of Sioux Falls through DataWorks, the one thing that started with, could you explain Sioux Falls' positivity rate or the region's positivity rate? Because there's been some discussion. When we start approaching 49%, there was a media report this week that said that really wasn't a fair comparison to the rest of the nation, because we're reporting our positivity rate differently than all the other states in the country.
Well, what we do know, and what I believe Secretary Malzahn indicated, was that we are reporting the data that calculates positivity rate based on CDC guidance. And so, what you see here is an accurate reflection of our percent positive in Sioux Falls. And just for the audience, back in August, which is what I'm looking at right now, we were at, just under 15% positivity rate. And we have just slowly kind of gone up and down in that area up until around the middle of October. And that's when we started really seeing that positivity rate increase. That's a combination of things. It's increased disease in community, as well as testing not being as prevalent as you might otherwise like it, because the more disease you have in community, the more you need to be testing, because the more tests you can do, the more you can get those individuals who are positive in isolation and those who have been in close contact with them in quarantine. And so that's why our rates are increasing, is because we have too much disease and we're not getting enough of that identified so that we can take the proper mitigation efforts.
Thank you. And the Director, the second thing that I noticed when I looked at the new numbers when they came out Saturday night was the 14-day total of new cases. Or can I say new cases? The 14-day total is somewhere in that almost 5,000 range for the 14-day total. And then when I read right next to it the asterisk that marks the next to that number, it says that this note regarding the 14-day total, according to the CDC, a low incidence plateau is defined as a very low number of new cases reported, below 10 cases per 100,000 population over the 2-week or 14-day period, with only minimal change in the daily cases. This equates to less than 26 cases over the course of the 14 days for the Sioux Falls area. Am I looking at that number correctly when I see 4,900 versus 26?
Well, you're correct on what the definition would be and what we would need to see in our community to achieve a low incidence plateau, and that is something that we are, as you've pointed out, we're very far from at this time.
So instead of 26 cases, we're at 4,984.
Yes, that's correct.
Wow. I don't know how to say that we don't have a problem. And I go back to the comment. Thank you, Director. That's the questions that I have. We have to slow the spread. And this mask mandate is way too late. It's not going to flatten the curve. What we're going to do is we're flattening the curve by allowing it to go vertical. The hospitals are full. We've heard from our healthcare professionals. We've heard from our teachers. And if we're not going to support them, if it's not this, then what should we be doing? I would agree with some of you that spoke tonight that this isn't going to flatten the curve. This isn't going to help our healthcare professionals. This is what we should have been doing in August. And instead, we were at Falls Park sticking our feet in the water, or we were doing anything and saying that it was over. Come have a party here in Sioux Falls. But what we've done is allowed it to get out of control. 4,984 new cases in the last 14 days. This mask mandate isn't going to do it. We're fooling ourselves to think that this is going to that this ordinance would make a difference. But in conclusion, what I would say, it may be too little, but it's not too late. And this is a step that takes us in that direction. And we said in the spring that we would do what it takes when there weren't hospital beds available. We're watching people having to bed and take single rooms and turn them into double rooms where one patient is positive for COVID and the other patient isn't. That just promotes the spread. We are at that point where we're asking medical professionals from across the country to come to Sioux Falls and save us because we're out of control. We are the political body of this part of it, of what we do as a community to come together. We've heard from the medical professionals what the problem is. I got nothing else in front of me tonight but this mask mandate, and I have to do something. I have to show the political courage and the political will to lead. I'm not done. I'm here to lead, and I'm here to do what's right for our community. And I'm urging, and I'm going to support this. And I sure expect the hard work that our health department's done with Director Franken leading us, there's more we have to do. We have to do more. We can't allow this to continue to spike in our community without taking further action. We hire public health professionals to lead us. We need to follow them. We need to have the political will to follow them. And that's what we need to do tonight.
Councilor Neitzer.
I belabored things last week, so I'll try to keep it short, although everybody else said they'd keep it short, and it wasn't so short. And I'm guilty of that, too. You know, I guess respectfully, I guess I'm just going to push back a little bit on just the assumption that, you know, you're only leading if you're imposing a mandate based on, frankly, I think a lot of hope that it will work without evidence, I don't think necessarily that proves it, and fear. I don't want, whether it's fined or not, I don't want to live in a city where people are calling the police because somebody's not wearing a mask. I don't think I haven't seen one, I don't think there's a peer-reviewed study out there that shows what a mask mandate does or what masking does in the general population. There's some things, I think, in the healthcare settings, and even those raise some questions. I'm not sure what the incremental benefit is based on what we have already. As far as, I've heard a lot of talk about businesses need this. I guess I don't get that. If you think that a mandate is what your customers need to feel comfortable, then do it. I'm not stopping you. You don't need me to do it. Many are already doing it. And by the way, if I go to a business and they require a mask, I don't make a big deal about it. I just wear it. You know, I just wear it. It's fine. I think it's a big step to impose such a mandate on all of the population with really no end date. I guess I hear a lot of emotion, and I get that, and a lot of fear, and I get that, but I guess I just don't see it, and I think it's not just about health. We also have to look at principles, and when people say that this isn't about personal freedoms or liberty, that it's not true. Of course it is. It's not just about that. Just like anything in life, any of our decisions, we have to balance the public good versus individual liberty and their intention, which one necessarily wins out. And we can all reasonably disagree on that. We're all good people. So, and I guess the other thing I want to say is I didn't think I would ever have as much input again, like I had the last time around, which was when we had the business restrictions. This has just been incredible. And those of you who sent me thoughtful dialogue that was on the other side, I really, really appreciate, because when you challenge me, that's what really makes me think. I mean, you know, if you say you agree with me, that's fine, but you know, that doesn't really, really make me think. We learn the most from the people we disagree with. And what I've loved about this dialogue, at least on this council, is so far it has been incredibly positive. There hasn't been, you know, personal attacks, because we all realize that we all want what's best for the city. And I just want to get that out there. Just keep remembering that we all care about people, whether you're for a mandate or not for a mandate. We care about people, and let's not dismiss each other because we disagree on a policy. You know, when I get emails that say, you know, you don't care if people die, or all you're doing is taking marching orders from the president or the governor, that's just beneath us. We don't need to attack each other's motives. We can disagree, but let's not be disagreeable about it. So I'll end it there. This is an incredibly tough issue. I guess I'm continue to struggle with. I'm not sure what we necessarily can do, and this is just a big step, and I just don't think the evidence is there. And even if it was, I'm not sure if I could go that far, just based on principle.
Councilor Sale.
Thank you. I'll just make two quick comments. First, if this passes or fails, either way, I would respectfully ask my colleagues to contact me tomorrow, and let's plan what's next. If it passes, what's next? If it fails, what's next? Let's keep working on this thing, because it's not going to go away. And secondly, there's been a lot of talk about fear on this, and I'll tell you what, I'm scared. I'm damn scared. 2 daughters that are nurses. I have 2 son-in-laws that work in healthcare. I have 8 grandchildren, and I'm scared for them. And I'm scared that when I go to bed tonight, if I do tonight, when I go, that I haven't done enough. You guys can do whatever your conscience leads you to do, and I respect that. I'm worried that I haven't done enough to protect my family and the citizens that I said that I would protect. That's where I'm coming from it. Thank you.
All right, thank you, Counselor. Counselor Brecky.
Passing city ordinances result in massive voluntary compliance. I can give you a list that just goes on and on and on. That's what we use ordinances for, to get a collective behavioral change, to work as a team with our citizens. The smoking ban, snow removal, nuisance ordinances, tree trimming. Can you imagine what the city would look like after a snowstorm if we didn't have a snow removal ordinance? Think about it. What about the trees? Trimming the trees. Can you imagine what the city would look like without a tree removal ordinance? Yes, we mandate it. No, we don't over-enforce it. It's a message, a strong message. And people, the businesses are going to have the choice of whether they want to call it in. And yes, there's going to be a handful of people who are going to test it, and they're going to go through the process, and they're going to pay their $97 fine, and they're going to move on. But I can tell you without a hint of doubt, because I worked at it for 20 years, I started every code enforcement program in the city. I started it. They didn't have any when I came. All they had was the traffic laws. Every department, fire, health, everybody started the whole schmear. A resolution will not do this. It will not give you the level of voluntary compliance that an ordinance will. It will not get you that kind of compliance. So don't kid yourself. And I can say this with absolute certainty. You will get more voluntary compliance if you pass an ordinance than you will if you do a resolution. Thank you.
All right, I think we've all had a chance to weigh in on this topic. I think we're ready to call the vote on this, please.
Counselor Jensen?
No.
Kylie?
Yes.
Neitzert?
No.
Selberg?
No.
Sale?
Yes.
Starr?
Yes.
Brecky?
Yes.
Erickson?
No.
Okay, so that's a tie. So my tie-breaking vote will determine this action. First, I want to go on record and say that I obviously believe in masks, the importance they play in slowing the spread of COVID-19. I was the first one, I believe, on this dais to wear a mask regularly, and I still do today. You'll see me on PSAs, supporting mask wearing, getting our public to promote the wearing of masks. I believe in it. I organized the mayors of the 16 largest cities in this state, representing half of the population, to come together and sign a joint letter on the efficacy and importance of mask wearing. It didn't happen organically. That took me reaching out to 16 mayors of the 16 largest cities in the state to have a joint message of unity. I've required my 1,300 city employees to wear masks indoors because I, as an employer of 1,300 employees, that's my decision. And I'd encourage other businesses to take similar actions. None of these efforts are going to stop. But all that being said, I've been on record for a few weeks on my position on this, so it's not going to come be a surprise on how I'm going to vote here. We're seeing case increases across the country from cities and states that have had these mandated for a long time. That's a huge challenge. The three largest top 200 MSAs right now with the most cases per capita in the last 7 days: Minneapolis, Grand Forks, and Fargo. Okay? People mention to me Fargo. Well, Fargo did it. Yeah, they did. And it's made little to no impact in Fargo. The unenforceable nature of it is a challenge. And I tell you what, this has been a bugger of a year for Sioux Falls Police Department and police in general. I'm not putting anything else on our cops. I'm going to defend those cops, and I'm not going to put anything else on their plate. And you may say, well, you're putting it on the healthcare workers. Well, there's a lot of things we can continue to do to protect our healthcare workers, which I'll talk about. I believe the small uptick in compliance we see from this, or we will see, are not worth the community division that this will create and all these other challenges that come along with it. The virus doesn't stop at Highway 11 or 85th Street. That's another problem with this patchwork city ordinances. Okay, our MSA is 270,000 people. Okay, I've said this a million times. I'm the mayor of 80 square miles. Okay, this is not an effective way to control a pandemic that doesn't know where the Sioux Falls city limits are. It's not effective. And finally, it's my belief that our community should rely on their own decision-making on this. If you have to skip Thanksgiving, you better skip it. Okay? You better make your own decisions for this. Some people have said that I was a lot tougher when the virus first hit. Yeah, I was, because at that time, 30 to 70% of South Dakotans were projected to get COVID, and we were projected to have 5,000 South Dakotans in the hospital at our peak with COVID. So we've learned a lot in 8 months, and our response has to evolve with that knowledge as we've learned a lot. So I'm going to continue to take a position of promoting facial coverings along with hand hygiene, along with staying home if you're sick, along with avoiding large groups when you can't distance. All these other mitigation measures. Not going to mandate any of those things or put them into ordinance. I know how emotional this topic is. I cannot overstate how emotional this is. And there's no winners tonight in this vote. There's no winners. This sucks to be in this position. So what can we do if we don't pass an ordinance? We can do these things that we know will slow the spread of this virus right now. And that's the things I just laid out. So my official vote on this is a no, and that item fails 5-4. Next item.
Mr. Mayor.
Councilor Starr.
Thank you. I would move to defer items 13 and 14 until November, next Tuesday. Bad math.
All right,
17th.
Is there a second for that?
I'll second it.
Okay. You want to unpack the rationale in that? Or?
Yeah, absolutely. Thank you, Mayor. We've had a long night, and we're all have gone through that, and I think these are two items that affect what the council's procedures are going to be. We're seeing lots of people leave because they're here for that, and these two are procedural of how we run our meetings, and it definitely will speed things up tonight. I know Director Cotter's been here all night, and I think his item deserves full attention from us, which is going to take some time, and then we have a funding issue as well to still tackle yet tonight, and these two issues would be, I think we can handle better next week.
All right, we've got a motion and a second on that to defer. Let's take a vote on that, please.
Council members Jensen,
No.
Kiley,
No.
Neitzer,
No.
Selberg,
No.
Sale, Starr,
Yes.
Brecky,
Yes.
Erickson.
No.
All right, that fails 5-3, so we're on to item 13, please.
Second reading an ordinance of the city of Sioux Falls, South Dakota, amending the code of ordinances of the city by amending chapter 30, city council, section 30.001, council meetings.
Councilor Jensen.
Thank you, Mr. Mayor. What this ordinance is doing for our city council meetings is moving it from 7 o'clock to 6 o'clock. Like we talked about last week, what this is going to allow us to do is take place of the committee meeting times that are now coming at us at an ad hoc basis, where we can have those at the call of the chair. So that is what this is simply doing. I'll ask for your support as we move forward tonight. Thanks.
All right, thank you, sir. Anyone from the public who would like to speak to this item tonight? Good evening.
Hi, good evening again. Richard Lemos, new resident. Last time we had this meeting, there was an election. If you would have moved it up as you chose to, people would have had an hour not to come out and voice their opinion. If you have this in place and there's something that crucial, move your meeting to another night. That way you have the opportunity to allow your citizens to do something that's important to them when it comes to an election for our president. That's all I have to say, but thank you.
All right, thank you, Richard. Anyone else here to speak on this tonight? Good evening.
Tim Stanga. Been coming to these meetings for about 12 years now. It seems like this is an ongoing deal. Teresa Staley sent out postcards to a lot of people in town. As soon as she gives me a call and asks me for money, she will get money from me. This is a big thing because a lot of people watch city input, watch the public input, then they shut the city council meeting off because they're tired of listening to yes, yes, yes. People realize that they don't get the truth from the city council. They listen to public input, and that's where they get their input from. Mayor realizes that if more people are watching the input of the city council meeting than the city council itself. So we got to make people watch the city council meeting to be able to listen to the input from the people of Sioux Falls. Just amazing that we're sitting at this point again. We had a city councilor that ran on that he was going to be for both sides because he just barely won an election. What side are you on now? I guess we're going to find out, aren't we? Because I'll tell you what, you're not on the citizen side. Last week it was stated that these people pay to come in and talk. That was by Nancy Pelosi. I'll tell you what, I've paid taxes ever since I've lived in this town. And you can go back on Tuesday, last Tuesday, you can replay it, and that's what she said. I am a taxpayer. I've been paying taxes ever since I've been out on my own. I pay property tax. I pay every tax in here. And are you trying to say that people that come in and speak for public input don't pay taxes or don't pay to come up here or don't deserve to come up here? If that's the way you think about public, then I can understand where you guys come from. But I'll tell you what, when we come up with this is an article from one of the city councilors because, one, he says that it's misleading. Well, this gentleman that wrote this is totally against Teresa to begin with, Greg Neitzer. He's been fighting with Teresa for the last 4 years. And should the public realize that this is being done? Yes, they should. Because of one reason, he stated that he was going to try to drop everything, try to work together and get back to doing things for the city. But obviously, he still has a grudge. Well, again, he states in here that the rich don't get any preference over the citizens of Sioux Falls that come in and talk. Well, I guess the thing is I do pay taxes. And it's pretty sad when it comes down to when you have to have a city councilor come in against a postcard because the people of Sioux Falls should know what this city council is doing to the public input. And you think it's going to be a lot easier on the public? I'll tell you what, I'll be here no matter what, and we'll still put our input in.
Thank you.
Bruce Danielson. let's just start out with saying this is, let me flip it around here for you. Well, somewhere in there. Can that flip again, or do I flip it again? There we go. As you'll see, next to number 13, we've got number 5 on our hit list. You guys really know how to do it right. We had an opportunity for you to finally get something right tonight, and appreciate the 3 votes on behalf of the public in that. But we know what $117,000 can do. We even get the people that led the effort to raise that $117,000 to buy this body, to buy a vote in this body. $117,000. We also have an ongoing mayoral campaign system that we really don't know how much money is in that pocket. We know that several other council members have residual money left in their accounts, so that those people that come before this body, they buy their way into this body, both by buying permits and getting their liquor license or their zoning changes. They bought their way here. The rest of us, 200,000 people in this town, or whatever the number is made up to be today, we don't count for anything. You've made sure that we don't count for anything. And you people want to run this town, you want to run it your way. You bought your way in here with $117,000 in cash from very suspicious situations. So if you notice, we're going to have quite a few open meetings violations tonight. And if you don't think I'm going to do something about it, you're wrong. There's a lot we can do. One of the things that's really bothering us the most in moving it to 6 o'clock is you have your informational meeting. The informational meeting is that little morsel of time that we can actually see things that are coming before this body. You're bringing this item, you brought the last one, and you're bringing the next one to the people for votes without putting anything over on that table, not having a website that's working tonight so people can actually go out and get information. You heard the president of the Chamber of Commerce was here and even complained he couldn't get information about any of this tonight because the damn website doesn't work. We went and spent $250,000 for junk, and we can't even make it work. When are we going to finally have an open government here? We were told this was the most transparent government we were ever going to have in the city of Sioux Falls. And there are times that we look at Mayor Huther and what he did, and we laughed about when he would claim to be the most transparent. That was so much more transparent than anything we've got in this city government right now. We have so little information that we get from this city government, and more is being hidden. I got hit in the back of the head by the previous mayor, and I believe that if given a chance, several of you would probably try to do the same thing. So we all have to be careful. That's what you're doing to us. You're telling us that the authoritarians are on the march. You're all looking at your paperwork so you don't look at us. I see people staring off in the distance because you don't want to pay attention to us. All of these people that were here tonight, whatever side they were on, you didn't listen to any of them. You didn't care. You made up your mind long before this ever came before this body. Whatever that decision was made a few minutes ago, that was predetermined to be that way. And we knew there was going to be one tie-breaking vote, and we already knew what that was. So you're telling us that all of these people wasted their time coming here tonight. I appreciated you bringing that, and I wanted the discussion, but I wanted to have it fair and square. And there'll be a point in time in the near future where we're going to have to talk about changing the form of city government. Thank you.
All right, thanks. Anyone else here to speak on this item tonight? All right, let's look for a motion, and then we can move into discussion. Oh, come on up, Mike. Good evening.
I wasn't going to talk on this one, but I thought.
Go ahead, man.
I was gonna talk on the next one, but I was gonna ask Alex a question. Alex, would you and Christine be willing to compromise? Maybe 6:30? Maybe if we can combine it with the experiment with public input? Maybe try some different concepts with the mayor's proposal, with the mayor? Would you be willing to go 6:30? Maybe meet halfway in the middle? That's a question I've been wondering about all week. I sent you an email last week about some ideas for public input. So I thought these next two kind of go hand in hand. If you would you be willing to compromise? Thank you.
All right, thank you. All right, we want to get a motion and then we'll move into discussion on it.
I'd make a motion to approve this.
Second, Erickson.
All right, motion on the floor to approve this by Jensen, seconded by Erickson. All right, discussion, councilors? Councilor Neitzer.
Just for the benefit of the public watching, after hearing frankly bizarre public input, the only thing this does is moves the meeting from 7 to 6 o'clock. That's it. I don't know what any of that stuff had to do with this agenda item. Are we going to have a public meeting at 7 or 6? I mean, frankly, it was delusional. So I just want the general public to know it's 7 or 6. That's it. All of that other stuff you heard was conspiratorial nonsense.
All right, thank you. Councilor Sale?
Yes, thank you, Mr. Mayor. I will support this, but I will also inform my colleagues that I will not support any movement of our informational meeting up during the day. I just think that will take away so many people's ability to serve on the council. So I'm for it tonight. If we start running exceedingly long in our informational meetings on a time, I probably would bring it back for your suggestion to move this back to 7. So I will support this tonight.
Mr. Mayor. Councilor Starr.
Yes, I have a question for the city attorney, and it'll probably save us some time here for the next items. We've presented the public with all the information they're entitled to, correct? We don't have to give them a printed copy that we continue to hear about, that whether it's a courtesy that we put it on the table for them?
That's right. Let me pull up the statute. I've got it here. 1 second here. It's loading, but under 1-27-1.16, which has been cited here this evening, it needs to be posted up on our website. The information that is provided to you is posted up on our website 24 hours in advance. Or if information is walked in, then it needs to have a copy in the back. So as long as you're posted up on the website 24 hours in advance, my computer is not loading, so I don't have the statute right in front of me, and I can't read it to you verbatim, but that is the gist of the statute. So all of our information has been posted up 24 hours in advance.
So the statute says or.
Or.
Okay, thank you.
All right. Other discussion on this item? Councilor Brecky?
Mr. Mayor?
Councilor Brecky, and then I'll go to you, Councilor Kiley.
Again, I think it's important that we're flexible as to meeting times, and as different bodies move through these positions, sometimes it makes sense to change it from time to time. I don't have a problem with changing it to 6 o'clock. I do share Councilmember Sale's concern, however, because if we're not allowing enough time then for our informational so that we are fully briefed, that could pose a problem. And so I don't want our briefing meetings to be condensed. I think it's important, especially since we no longer have the directors' meetings where we were getting some information, at least some of us were at some points. And I don't have a problem with it, except to the extent that with item number 14, if we are talking about moving public input to the back, then I would say that by moving this to 6 o'clock, I think it's important that we consider not moving the public input to the back because we have really given everybody an extra hour, and it really makes no sense then, I think, to move public input to the back of the meeting because everybody has this extra hour anyway, and so I think we are accommodating, our citizens by not doing that. So I do have no problem with this, and I will be voting for it, but I would also use that as an argument that since we have done that, we should probably just leave our public input the way it is, and this just accommodates that further because our meetings, will actually get us home earlier if that's part of the goal.
All right, thank you. Other discussion, council, on this? Councilor Kiley, were you
Mr. Mayor?
go? Go ahead, sir.
Thank you. I do support this. It actually assists in the area of providing and making available public transit and paratransit to individuals that need that and would maybe want the option of attending our meetings, but depend on public transit or paratransit. Starting earlier will actually improve on the availability of that. So I am in support of this proposal. Thank you.
All right, thank you, Councilor. Other discussion from any councilors? Councilor Neitzer, go ahead.
I will just also share Councilor Sale's concern. I think it is going to be a challenge. We're going to have to figure out how to do it, particularly for a chair that's running an informational meeting of how do we do that and how do we make sure that it's scheduled properly. So we're going to have to figure that out, and it's going to be a bit of a, it may be a challenge, so we're going to have to be willing to be flexible. Thanks.
All right, thank you. Other discussion, council, on this one? Councilor Brecky.
I just want to say one thing because it came up during this discussion. In this meeting tonight, I've heard the word friggin', I've heard the word suck, I've heard the word hell, I've heard the word bizarre, I've heard the word delusional, I've heard the word conspiratorial nonsense, and quite frankly, I think that kind of language violates our decorum, and I would ask you, Mayor, to stop allowing people to use that kind of language during the meeting. You have complete authority to do that. All you have to do is look at the decorum section, and I realize that word friggin' was used by you. You probably wish you didn't use it, but I'm going to ask that it be a decorum issue for this meeting because I don't want to continue hearing it being used. So I'm going to ask, as a matter of decorum, that people be instructed not to use that kind of language when it happens, because I think the overall tenor of the meeting is really harmed by that. And Councilmember Neitzer, I mean, you just said earlier in the meeting that there was none of that and how good the discussion was that we just had. And then you used that kind of language and stirred all of that up. And I think at some point we have to address that issue. It has to stop. And I'm just asking and telling you that, as mayor, that you do have authority to deal with that. And I'd ask you to do so.
Thank you. Any other discussion on this? All right, let's take a vote, please.
Council members Jensen,
Yes.
Kiley,
Yes.
Neitzer,
Yes.
Selberg,
Yes.
Sale,
Yes.
Starr,
No.
No.
Brecky, Erickson.
Oh, I'm sorry.
Yes.
Excuse me,
All right,
Mayor. Can I change my vote? I
can.
want to vote yes on this.
Okay, that's a yes vote
Getting
for
tired.
Brecky. So that passes 7-1. Next item, please.
Item 14, second reading an ordinance of the City of Sioux Falls, South Dakota, amending the Code of Ordinances of the city by amending Chapter 30, City Council, Subchapter Organization and Procedure, Section 30.013, Order of Business, and Section 30.015, addressing the City Council time limit.
All right, Chief of Staff Erica Beck, you're on the line. You're going to speak to this tonight?
I am. Thank you, Mayor. Good evening, Mayor and Council. I appreciate the opportunity to call into this meeting tonight and introduce the second reading of this proposed ordinance amendment. As the Mayor stated last week, this ordinance amendment proposes to change the order of business for this meeting, allowing the business of the meeting to be conducted along with public input on each of the business items before this body hears general public input. Following the business of the meeting being conducted, there would remain an opportunity for general public input to be heard. The change to allow for the business of the meeting to be conducted prior to general public input requires two changes in this ordinance, both in 30.013 and 30.015. Again, I want to stress that this amendment does not eliminate any forms of public input that already exist in this meeting. It instead changes the order in which these items are to be heard. Thank you very much for your consideration.
All right. Thank you, Erica. Anyone from the public wish to speak on this item tonight, please come forward.
Bruce Danielson, I guess the delusional one. One of the things that apparently we've learned in all of this that's going on is the phrase "one Sioux Falls" means only one thing. The authoritarian policies of one person are all that matter. I have gone back out and pulled up a document that Diane Best wrote, what's supposed to be the definitive marketing material and explanation material on what meeting materials are. On page 17 of her PDF that's supplied by South Dakota Municipal League. I've been in touch with members of the South Dakota Newspaper Association since all of this has come about. And to them it's very clear. Meeting materials, printed materials relating to the agenda item and is given to the public body generally must be available to general public. 1, posted on the website. 2, available at the business office. 3, in the meeting room. And that would exclude confidential materials. Source, SDCL 1-27-1.16. It's pretty clear. It's supposed to be in this room. The Walworth County auditor has been in a lot of trouble up there in the Mobridge area because of that very situation. They're trying to, this week, they were trying to determine how far they're going to go with that whole issue. But I guess we have to go back to this, because it's just darn hard to be mayor without being an authoritarian, I guess. One of the issues that we have with this piece, and if we had actually this printed out here, I could actually point to it, but we have an issue here of prior restraint.
Point of order, Mr. Mayor. Does this have anything to do with the topic at hand?
It has everything to do with the topic at hand.
I'm hoping he gets to it, so yes.
Because prior restraint is what this is all about. By voting for this, you're saying that if one of us comes up to the podium at the end of the meeting and we speak about anything that had been discussed that night, we're dealing with prior restraint. And prior restraint is unconstitutional. It's a First Amendment right. For us to come up to this podium during a public input session, germane to the business of the city, and discuss anything that you people talk about and vote on during the course of that meeting. Prior restraint is key to everything you're doing here. We're asking about saving public input where people can actually be part of the meeting. What you're doing by putting it at the end of the meeting is making it so people can't be here at 11 o'clock at night, because that's what's going to be happening. So the reason why you're doing it is because you don't want to be embarrassed. You don't want us to talk about what you just did, the stupid things that happened in this room. You don't want us to talk about the things that we're seeing, the things that are the crime that's happening in the different neighborhoods around here. You guys don't want us to be here to talk about everything that we are finding. You're dealing with violating prior restraint, and you better think really clear about this before you get going, because the courts constantly uphold our right to come before these bodies. One of the other things that you're going to be probably wanting to study real close is Lozman v. City of Riviera Beach. That one was settled in 2018 after a gentleman stood up at a podium just like this and was arrested because they put prior restraint on him. And he didn't even have to open his mouth. They shut him down and had him arrested. He only got $875,000 from the City of Riviera Beach, and they shut down a $26 million building project because of it.
Thank you. Anyone else here to speak on this tonight? Come on up.
Just an idea I got, I think I emailed you a couple times, but if we're gonna move the meeting up to 6 o'clock, like, I agree with Jan on this. I mean, we should keep, what if we vote this down and just keep public input in the beginning of the meeting? And even if you want to do a different concept, maybe try something different with public input in the beginning, maybe put 15 minutes on the end. Maybe try something like make reservations in the first part of the meeting, so certain citizens can come up and make suggestions by reservation, and then maybe have a 15-minute session at the end of the meeting, so you get the citizens get a little bit of both ways. But just an idea I had. I just thought, see what the mayor thought about it, and see if if we can come up with some compromise or something. You know, that's why I was asking if you would be willing to go half on that, maybe 6:30, you know, and try something different. Just a thought. No, but I do agree. I mean, it's funny this came up this week because I just wrote a letter to the editor. I mean, we got to be more respectful of each other, residents and the city, and we got to be mindful of that. I think the mayor sets a good example as far as trying to run a good meeting, and we can learn from each other. Just my thought.
Thank you, Mike.
Sierra Bruce with Sioux Falls. So, I'm all for pushing public input to the back. The only thing is, then we're not going to limit public input to 10 people or less. And so we're going to get back to 5 minutes on this. So I think that'd be a compromise. We can't restrain people's rights here. We got to follow the Constitution. So, yeah, that's fair and square. So I think being fair is to give it back. Give back public input to where it was, with no limits and 5 minutes, and that should be okay.
Thank you. Anyone else here to speak on this item tonight? All right. Should we get a motion?
Mr. Mayor.
Move into discussion. Oh, go ahead, Councilor Erickson. Do you have a question, or do you want to?
Yep, I'll make nope, I'm going to make a motion to approve.
All right. Motion by Erickson. Do we have a second for that?
Second, Jensen.
All right, seconded by Jensen. We can move into discussion. Councilor Brecky, did you have your hand up and wanted to speak?
Yeah, I'd like to speak. First, I really want to divide my comments into two categories. First, I talked a little bit about it last week, and I'm going to talk a little bit more about it this week. I really am concerned about the process by which this came forward. And I talked about it. I want to talk about it in the form of civics, of government class. I mean, we're talking about checks and balances on power, and this government is set up so that we have an administrative branch and we have a legislative branch. In many ways, it mirrors the state government. And The mayor's office has full administrative powers, and it has powers over all of the administrative powers of the city. And the council has all of the policy setting or legislative powers of the city. And when that charter was implemented, the mayor was given the authority to bring ordinances to the city council in order to execute his administrative authority. This ordinance that's being brought by the mayor's office, again, without really any working with the council, again, through the council's procedures. I mean, it's like it's amending our policy and procedures manual is what it is, because usually that's how we run these things through, how we deal with, it never went to the operations committee. So, the fact that the mayor has the authority to do it, I'm not questioning that. But I hope you'll understand for the future, it's something we need to be thinking about, because the mayor's office is bringing an ordinance telling the council how to do its business, telling the council what kind of access the council should have with the public. The best way I can explain it is just imagine, I'm just going to pick on Governor Dugard when he was governor. Let's just imagine Governor Dugard stepping down to the legislature and bringing some legislation and saying, I want you guys to tighten up your committee process. Things are too slow. You need to slow down. You need to put time limits on testifying before committees. You need to make this stuff go faster because you need to do your legislative job faster. I'm not saying the mayor shouldn't have a voice in it, but I'm saying when the mayor's office unilaterally brings something, doesn't go through our regular processes, tells us how to change a meeting, it's just weird to me. It doesn't make sense to me in the fact that we have two separate branches. And I think it feels to me like they're overstepping their process a little bit. Because in the mayor's office, when he's talking with developers and businessmen, and they're preparing items that are put on, administrative items that are put on our agenda, there's no time clock on them. I mean, you sit and talk through it, and you get it all together, and you're bringing it forward to us in a package. But we put this time clock up, under this administration. We put together what's in place for public input using compromise. And this is an issue that is really, really important to me, which is why I put my name on a postcard and put money for that postcard, personal money, to bring people out of the woodwork, to let them understand just how important this really is. And so one of the things I'm concerned about is I do, quite frankly, think it's overreaching. I think that we should consider in the future an ordinance that if the mayor's going to start dabbling in our processes and how we do our business and how much time we spend with the people that are coming to see us at the council meeting that really belongs to them. Because again, this is the city council's meeting where we do business with the public. I mean, we do their business in public, and like I said tonight, I listen to them because I let you help me make my decisions. And so how long we let them testify, it's kind of like, again, this is their chance to go in front of the whole collective body and talk to us all together. And we'd give them 3 minutes and a half hour, and it's worked really very well. And now we're going to shove them to the back of the bus, and that's going to have an effect. So, number one, I'm concerned about this process. Quite frankly, I think it's overreaching by the mayor's office. And if the mayor's office really wants to make recommendations to the council as to how they should do their business, then I think he should work through our council procedures and processes. And quite frankly, in the future, I think that he should have a 2-member sign-off. Because I think 2 other council members should be supportive of bringing something forward that actually affects the way we do business. Now, be clear on this. This doesn't apply. This is not what I'm talking about when we're bringing zoning ordinances and planning projects and all of that. That's his job. That's administrative stuff. But when he's tinkering with our meeting process and how we do business, and again, his limited role is just that of chairman conducting the meeting and having tie-breaking vote and veto power, I mean, I think that that's too much mayor into the council's business. And so I have a problem with that. The other problem, now I'm done talking about that. I think it's important. But the next thing I want to talk about is the substance. The mayor said when he presented it last week that this was merely a procedural ordinance, and that was also restated in the letter that was put up on the screen here, that this is just a procedural matter and it doesn't really do anything at all. I would disagree with that wholeheartedly. This is a substantive change. I think that some of the council members are tired of listening to some of the, what I would call government watchers, who regularly attend our meetings, who spend significant time of personal time watching government and are committed to trying to get improvements that they think they would like to see in their government. And I think this is retaliatory. I think that there's a hope here that if we move it to the back, that there will be less public input, and that it will be more difficult for people to come. And I think that it's punitive. I think we're trying to punish those court watchers that are coming regularly because we're tired of hearing their criticisms. And in the mix, when we move it to the back, they'll probably keep coming. They're probably committed enough, these court watchers, to keep coming. Who we're going to lose are all the other people who've come that have gotten results, who have brought forth very interesting, sometimes poignant, tonight, complimentary stuff. Kurt Sale said it, Councilmember Sale said it last week. I've gotten used to it. You said you've gotten used to it, and I would say a half an hour, 3 minutes each. Is that really asking so much to let those people come first and have their 3 minutes for their half an hour? That's 10 people. And then moving on. I think we're going to lose out on young people. I had some poignant stories and some emails about a young girl who came and who came before the council when she was 5 years old, and she wanted the library hours to be opened. And someone told her to come to public input, and they opened the library hours longer on Sundays so she could read. There was a handful of stories in one of the emails I received. There's been multiple times, Mayor, when you've had your staff hand them your card because these are people who fell through the cracks and you were able to solve their problems. There's, again, the complimentary stuff that we received. I don't think those people are going to sit through an entire meeting in order to have their 3 minutes. And I think that, the compromise that we made wasn't broken. It was working. And as you'll recall, it came forth in two settings. We tried it once, and then I came back with some amendments and tweaked it, and it was working just fine. I don't know where the complaints came from. I don't know why we're changing this, but I would wholeheartedly say this is not procedural. This is substantive. And I believe, without a doubt, that it's designed to stifle democracy. It's designed to stifle public input and to limit it.
Thank you.
And I've just
going?
got one further thing. Obviously I'm not going to support it, but there is another issue with it. As it's written, as it's written, the language in it, I think clearly violates the First Amendment because it prohibits people who testify during the open public input portion of the meeting from testifying to any action that we've taken at the meeting. It says that they cannot testify, and that's how it was explained last week, that they cannot testify to items that we've taken action on because they've already got to testify before we took action. I think you've got a serious First Amendment problem with that.
Thank you. Councilor Sale.
Thank you, Mr. Mayor. As some of us remember, that 2.5 years ago, we went down this train, and led by Councilor Selberg's attempt to move around and cleared up, and we reached a compromise at that point. And we had hours and hours of testimony, average citizens, business leaders, asking us what to do. I have yet to have a single member of the community tell me that we should change this. So I think I'm going to stick with what we did 2.5 years ago, and I'm not going to support moving this to the end unless there's an amendment coming forward to have unlimited public input.
Thank you. Other discussion on this? Councilor Selberg, go ahead.
Yeah, obviously we know what we went through here a couple of years ago. I would be apt to support it for a couple reasons, that we're not shortening the time people can speak, and they do have an opportunity. But I would also, if we do move it, I would support taking the 30-minute limit off. So if there are people who do wait to speak, that they don't get cut off. There's somebody who waited and then for some reason they're cut off, there's not time. So I will probably support, but I'm open to that type of an amendment where there's no limit to.
Councilor Erickson.
Thank you, Mr. Mayor. One of the things that I just wanted to just touch on that was left off when the charter part was discussed, the section 3.01, it does say executive power. The executive and administrative power of the city shall be vested in the mayor. It's not just administrative, it is also executive. And so I just want to make sure that that word is not left off again, because I think that's a key component to the conversation that we're having here. The other difference is, you know, as we talked about, I heard Councilor Brecky talking about Governor Dugard and almost referring to him as if he was a member of the legislature, like he does dictating committees. That's not the way it works. It's very different throughout that. And so I think it's apples to oranges for that. For me, again, this is procedural. I do support the First Amendment right, and I think that it's just a matter of where it's placed in an agenda. This isn't just about someone that has paid to be on an agenda, but it's also about those folks that maybe didn't want Walmart in their backyard, or a rezone, or a conditional use permit. They didn't pay to be on the agenda, but they don't want to see that rezone or that development take place, and they have every right just to be there just as much as somebody that does want a rezone. It's just a matter of, do we do the business first or the public input first? It's really just to really simplify it, I think is really important. As we move forward with this, I do support it, and I hope that my colleagues will as well. I think it's an important area to note as well that public input doesn't just take place at these meetings. It takes place in the grocery store, at soccer tournaments. It takes place over email, text, and phone call. And when those phone calls come in, oftentimes I don't have a time limit on them. I spent an hour and a half on the phone the other day on the mask issue with someone. I didn't have a 3-minute time frame. And I tell you what, I learned more from that person that I disagreed with than having them come in front of me for 3 minutes. And so I welcome people to reach out and have those ideas. I know we all read our emails and go through that, but public input takes place in all forms and fashions, not just at this meeting. And to be honest, oftentimes it's more productive outside of the meetings, because we get to have that dialogue back and forth instead of just kind of sitting there staring at each other as we go through it, which I welcome and I appreciate. The First Amendment is alive and well, and I hope that we can all just kind of support that as we move forward. Thank you.
Councilor Starr.
Absolutely.
Mr. Mayor.
I'll go to Councilor Starr and then you, Councilor Kiley.
I would defer to Councilor Kiley because I have a couple of amendments that I want to.
Councilor Kiley, go ahead.
Thank you. The previous issue I supported because of the positive impact it would have on individuals relying upon public transportation. In this case, I'm not going to vote in favor of this for basically the same reason, that it would make it very difficult for individuals that rely on public transportation to participate in public input if it is moved to the back of the meeting. So I'm a no for a different reason, but that's where I stand on that. And secondly, I think that the compromise that we did make nearly 2 years ago and arrived at, I do believe it has been working well. It has, I mean, we do know that public input isn't going to last longer than 30 minutes, and I'm not certain that we've had a single meeting where it has actually reached that point. So I'm satisfied with the system that we have in place, but my primary reason is the impact it would have on individuals with disabilities that rely on the paratransit, as well as other individuals that rely on our public transportation. So thank you.
All right, thank you. Councilor Starr.
Yes, thank you, Mr. Mayor. I am going to move to amend by striking the following words in 30.015B, shall last no more than 30 minutes, and.
All right, motion there. Is there a second for that?
Second, Brecky.
Okay, motion by Starr, seconded by Brecky on that. You want to speak to that at all, Councilor?
Absolutely. It's one of those things that if I'm having a hard time for the similar reasons that I don't think that that the compromise has been broken, and I'm not sure that we need to move it. But if we are going to move it, we should allow everybody who's here to speak. And I can't remember the last time we went past 30 minutes, even at the beginning of the meeting. So if we have to stay a little bit longer, I think that's what we're here for.
All right. Discussion on that amendment, Council? All right, not hearing any. Let's take a vote on that amendment then, please.
Councilmembers Jensen,
No.
Kylie,
Yes.
Neitzer,
No.
Selberg,
Yes.
Sale,
Yes.
Starr,
Yes.
Brecky,
Yes.
Erickson.
Yes.
All right, that passes 6-2, so we're back to the main motion as amended. Further discussion, Council, on this? Councilor Neitzer, go ahead.
Yeah, I'll try not to repeat. I do want to set the record straight, at least in my view, because I think it is important. A postcard did go out. I don't, or whatever it was, I didn't get it. I saw a copy of it. I don't know who bankrolled it. I frankly don't really care. But I did have to discuss with several citizens and walk them through the issue, and I just want to make sure I just hit a couple of topics. It really was misleading and inflammatory, and unfortunately this isn't the first time that's been done. And I spent a lot of time essentially explaining reality and what this was really doing. It makes the accusation that the public only gets to do their input, or that input is only received at general public input, which we all know is not true. We receive input on every single agenda item. The public can speak to any agenda item. This doesn't stifle input whatsoever. It's not a choice of no input or input. It's just a choice of when to have general input or when to take input on agenda items. It used the demagogic technique of talking about using words like developers, business elite, those sorts of things that pits quote unquote average citizens against quote unquote developers and rich versus poor to inflame people's passions. We all know that there's a lot of average citizens just a few minutes ago that give public input on agenda items. And frankly, when there's an agenda item that a developer has, you have one developer and you might have 20 average citizens give input on that item. So this idea that the public only uses general public input and then they go home and it's just a bunch of wheeler dealers sitting here with fat checkbooks coming up to testify on agenda items is totally, totally misleading. And I thought that was just terrible. There's so many things that people come and speak to that affect their lives immediately. It's a rezone. How many times do we have an apartment rezone? Well, why is it a given that if you're coming to speak at general public input about something not on the agenda, and frankly may have nothing to do with city business that I can't control whatsoever, why is it a given that they are more than, and that somebody who's there because there's something that affects their life is less than? Why is that citizen less than? And sometimes you have the same citizens using public input, general public input, and then you have them speaking to an agenda item. Are they less than an hour later? It doesn't make any sense. But what this thing was counting on was using distortion and inflaming people's passions and using things, all of these developer and all of these things, knowing that it just is going to inflame people. And then you get emails saying you're for the business elite and you don't care about the average citizen. The elderly, the handicapped, they come speak to agenda items. In fact, they may be more pressing. No matter what, somebody has to wait. The only question is who. Some average quote-unquote citizen, using their terminology, has to wait. This is procedural, but don't fool yourself. This isn't about being for or against input. All it is which should go first and which citizen should have to wait. Someone has to wait. That's it.
All right, thank you, Counselor. Counselor Starr?
Thank you, Mr. Mayor. I think one of the things that I did is I went back and researched the history of why the council in 2008 moved public input to the front of the meeting. Because in their opinion at that time, they gave priority to average citizens. And what was interesting to one of the counselors' comments that I talked to that did it was because they respected the public. They respected the average citizen who has a difficult time with something that happened in the city. Like Councilor Brecky said, someone who fell through the cracks. How many times, I say each week there is a nugget in public input surrounded by a whole lot of other stuff. And I get that. And government's messy, and I totally understand that, and I wasn't sure that I liked the compromise at the time. But this counselor pointed out to me, the one of the two that I talked to that were on the council at the time, pointed out that in his opinion, and I think that's the opinion of some, is that maybe public input had been hijacked by a small group of people. And this measure is basically a way to retaliate and to try to slow them down. This measure, by moving it to the back of the agenda, doesn't make it better for the 83-year-old lady who stood right at this podium who was attacked by a Rottweiler. And animal control didn't have the tools that they needed to destroy the vicious animal. We now have a vicious animal ordinance. I watched last night, and I was going to play it for us tonight, but I don't, obviously at the time, the 5 minutes of public input from Mr. Fodness. I'll challenge you to go back and watch it. It was probably the most moving testimony you'll ever hear in a life. To have a father stand in front of us and talk about how his daughter, he thought she was dead under the rubble in the building collapse that happened in downtown Sioux Falls. If somebody has to wait, Councilor Neitzer, I think that the rest of the agenda can wait for those individuals. And really, if that's what the decision is tonight of who's going to wait, I'm going with public input every time.
All right, thank you. Other input, Councilor Sale, go ahead.
Councilor Neitzer reminded me of something that kind of changed my mind last time from the back to the front, and he talked about developers. And two prominent citizens 2 years ago came forward in public and recommended to us that we keep public input as it is today in the front. Craig Lloyd, who is probably is the largest developer in our area, recommended to this council to keep it at the front, and Tom Walsh Sr. And I remember that because the only 2 times I've seen those guys here. So I thought that made an impression. So when you've got prominent developers telling us to keep it at the front, that's probably where public input, it's a good discussion. Who goes first, who goes last? We have that all the time. Thank you.
All right, thank you. Other discussion on this? Any councilors on the phone? All right, Councilor Brecky.
This is the people's meeting with the council. That's what this is. That's what it's supposed to be. And we're talking about who goes first, but we're talking about a half an hour to let a maximum of 10 people talk for 3 minutes. That doesn't interfere with business items. That doesn't interfere with the people who've had hours with administrative staff, visiting with them and honing their project to get it ready to be brought forward. And those people, they have an audience with the council and the mayor anytime they want it. These people's really only shot at us as a collective group. I get that there's other forms of communication, but it's also about accountability. This is a chance for people to come up and criticize us and hold us accountable for decisions we make and conduct that we have. And again, if they're not going to be allowed to comment on our actions at that meeting, we have a serious First Amendment problem. But just as a practical matter, a half an hour, 3 minutes, is it really about who goes first? I mean, we're seeing 10 different people in a half an hour, and then we're giving all this other time to the business of the city. I just urge your support of leaving it as it is. There's been no showing by the mayor's office as to why this procedural change, substantive change as I call it, is necessary. Thank you.
All right, Councilor Neitzer, go ahead.
Reiterating one more time, I still don't get why citizens there to speak on an agenda item, like a 6th and Bonson rezone, as an example, are automatically less than and dismissed as not as important as somebody there for general public input. To be intellectually honest, you have to admit you're making somebody wait. Don't pretend that if you go one way, that you're for citizens and that you're against the evil developer. You're making somebody wait, no matter which you choose. We have a lot of ordinary citizens speaking to agenda items, and they have to wait. And you decided that, quote unquote, you're going to put them to the back of the bus. So if that's the rhetoric we're going to use, then we're just basically debating who we're shoving to the back of the bus.
All right, thank you, Councilor. All right, I think we're ready to call a vote on this item.
Councilmember Jensen,
Yes.
Kylie,
No.
Neitzer,
Yes.
Selberg,
Yes.
Sale,
No.
Starr, Brecky,
No.
Erickson.
Yes.
All right, that item ends in a 4-4 tie, and I will choose to break that tie with a yes vote, so that item passes 5-4. Next item, please.
Item 15, first reading, an ordinance of the City of Sioux Falls, South Dakota, authorizing the issuance of its wastewater system revenue bond in one or more series to the South Dakota Conservancy District, authorizing the use of the proceeds thereof for capital improvements, pledging the wastewater system revenue of the city to the payment of said wastewater system revenue bond, fixing the terms of such wastewater system revenue bond, authorizing the execution and delivery of a loan agreement between the city and South Dakota Conservancy District, and authorizing the execution and delivery of such wastewater system revenue bond to the South Dakota Conservancy District not to exceed $18,500,000. Recommendation, set a date of second reading for Tuesday, November 17th. Sponsor Mayor.
Good evening, Mark.
Thank you, Mayor and City Council. I just have a couple slides to frame up this item. It is the first reading. Next, at the second reading, we will bring our bond counsel here for you, but just to procedurally get this read into the record, this would be a loan. It's the second of 4 loans to fund the wastewater plant expansion project. We've framed up the existing plants in the northeast corner of the city. We've seen this slide before that we are working forward on making recommended improvements to various processes of the plant. Again, this is loan 2 of 4. It would be for $18.5 million from the state of South Dakota through their state revolving fund loan. The first loan, we have terms of 2.5% interest at 20-year term length. This one, they've recently reduced that interest rate down to 2% for 20 years. And in the fall of each year, we would be back here in the fall of 21 and the fall of 22 for loans 3 and 4. Have a schedule slide, and as we're moving forward, we're in the process of developing the 30% design documents, and I would ask you for your support tonight.
All right, thank you, Mark. Anyone from the public who would like to speak on this item tonight?
Find thousands of local jobs right at your fingertips.
Come on up.
Bruce Danielson, I guess all I'm going to say is, before I leave tonight, that you have accomplished another open meetings violation. That'll go on the record, and I can see a few shaking heads over here, but got to do it and have fun.
All right, thank you. All right, counselors, do you have any questions for Mark on this item?
Move to approve.
All right, I got a second for that one? Second. All right, motion by Sale and seconded by Selberg to approve item 15 there. And that's to set a date of second reading for Tuesday, November 17. Discussion, counselors, on this? All right, let's take a vote, please.
Council members Jensen,
Yes.
Kiley,
Yes.
Nitzert,
Yes.
Selberg, Sale,
Yes.
Starr,
Yes.
Brecky,
Yes.
Erickson.
Yes.
All right, that passes 8-0. We'll move to item 18, which was moved in our agenda.
First reading, an ordinance of the City of Sioux Falls, South Dakota, providing supplemental appropriations to fund a COVID-19 public health education campaign in 2020, held $20,000. Recommendation is to set a second reading for Tuesday, November 17, 2020. The sponsors are council members Brecky and Sale.
Councilor Brecky?
I think that I explained earlier when we had the discussion on the masks, the method behind the madness in these ordinances. I think regardless of how we went with the mask ordinance, I think we need there to be sufficient funding for messaging throughout the duration of this crisis. And so there's a little bit that would need to be spent by December 31st, and then there's a second one which I will be moving to defer to, got it written down here, January 5th, I believe. Yes, so that there would be an amendment to the budget so there's sufficient funding for the health department to engage in a messaging program as this emergency continues. I think it's something, we're learning as we go here. If I looked back on it, it's something I wish we would have done all the way through, that we just had some designated funding for them to get a consistent message so that we can, establish a camaraderie and a teamwork spirit with the public. And then, yeah, maybe we wouldn't even be here having to have this mandate if we'd have just been messaging all the way through in a very positive way. I'd like to show you an example of what I'm talking about. I want to make a distinction between public education and an advertising message. We not only need to educate people on what we want from them, but we need to sell them on it in a positive, upbeat way.
Cover up for safety, cover up. When going out in public, always cover up. Show your world you care by the mask you wear. Cover up in public, cover up. Cover up for safety, cover up. You leave your house, then that is when you cover up. Put your mind at ease, tell your family please. Cover up In public, everybody cover up.
The CDC says if you don't have a mask, get one. If you do have a mask, use it. Masks can and do prevent infection and spread every day.
Cover up for safety, everybody cover up.
I want you all to know you received it in the hundreds of emails that we've received. You know, you click on as many, you read as many as you can. This was at the bottom of one of them, and it just happened to be one I read through, and I clicked on, and I thought, that was amazing. For anyone of my generation, that is an old seatbelt jingle. And when you think about it, it's a very analogous situation. They were trying to convince the country that seatbelts were helpful and saved lives. And that jingle resonates, it sticks with you, and I think that that's the kind of thing, and in fact, they can use this. I got permission to play it tonight. She said they could use it if they liked, but I'm just using it as it was my inspiration for these two ordinances. I thought that's the kind of thing that we need out there, not just education, but sales and marketing, selling the people in a positive, upbeat, team-building, spirited kind of way. As we move through this. For the mask right now, but then there's going to be other issues. There's going to be the inoculation issue. We're going to be needing to, educate on that. And our education and programming, may need to be more unique and to the city of Sioux Falls than just the mask up South Dakota thing. I mean, I think there's going to be, we need to speak with our 250,000 people here in our MSA area, and tell them what we need from them. And so it doesn't come with any strings. I've talked to Jill Franken in the health department and said, obviously we trust you to work, whether you work internally or whether you hire an advertising campaign. I'm envisioning something that has layers, includes, billboards, it's television, radio, capitalizes on the PSAs, uses our television, Channel 16. If we could be doing that as we progress through this, I think we could move forward in a positive, unified way and just do a better job of messaging than just trying to use our business vehicles like press conferences and news releases and those sort of things. So that's the method or the inspiration for it. That was my thought process on it. If you've got any questions, I'd be glad to answer them.
All right, thank you, Counselor. Should we put a motion on the floor and then we can see if there's any discussion on it?
Move to approve.
Second, Star.
All right, motion by Brecky, seconded by Starr to set a date of second reading for the 17th next week.
No, actually, okay, which one are we doing?
We're on
Or
item
number 18.
18. Yes.
18, November 17th, set a date of second reading. Is that the motion?
That's correct. Thank you.
Okay. That's the motion, the second. Discussion on that, Council? All right, hearing none, let's vote on that, please.
Council members Jensen,
Yes.
Kylie,
Yes.
Nitzert,
Yes.
Selberg,
Yes.
Sale,
Yes.
Starr,
Yes.
Brecky,
Yes.
Erickson.
Yes.
All right, that passes 8-0. Next item, please.
Item 16 is a first reading, an ordinance of the City of Sioux Falls, South Dakota, providing a provisional one-time supplemental appropriation to fund a COVID-19 public health education campaign, Health 100,000. The recommendation is to set a second reading for Tuesday, November 17, 2020. The sponsors are Council members Brecky and Sale.
Councilor Brecky?
I don't think I really need to add anything further. It was my intent for my explanation to really apply to both of them. I want a seamless transition that it gives them a set of funds designated for, sending a consistent message as necessary as we move through this crisis in whatever way the health department determines are the issues that we need to unify the public around us on.
All right, anyone from the public who would like to speak to this item? All right, let's get a motion on the floor on this one.
I do need to move to amend it. It would be my intent to have the second reading take place January 5th, 2021, because as I understand it, we cannot amend the budget until the budget is actually in effect.
All right, looks like, did you want to speak on this item, sir?
Yes, coming from, once again, Richard, new resident. Coming from 2 different states, I had a chance to look at our most vulnerable seniors come into my stores and not have the proper protection. Well, the masks that they had are just surgical, reused over and over, dirty, stained, also to having it above their below their nose, not worn properly. So the education needs to go into is like cross-contamination, proper wearing, and what type of mask is really going to help out those who are more high risk than just others. So I'm all in favor of education, all for people to understand what they're encountering. So you should think of it as a way of combating your health against this virus. But when people are just being told wear a mask and they're not actually being informed the harms of what your own person is doing is hurting yourself, that's kind of bothersome to me, because I believe in education. I believe in people understanding how to protect themselves, but just saying wear a mask and not the education behind it to show them what fault to hurt themselves is concerning.
All right, thanks, Richard. All right, Councilor Breck, you want to make a motion with that date?
Move to amend that we set a date of second reading for January 5th, 2020, or Tuesday, January 5th, 2021.
It's not actually, I don't think we need to amend anything. You can just make the motion, original motion for that date.
Okay, move to set the second reading for Tuesday, January 5th, 2021.
Second, Star.
All right. Motion by Brecky, seconded by Starr to set a date of second reading for the 5th of January. Discussion on this one, council? All right, hearing none, let's take a vote, please.
Council members Jensen,
Yes.
Kylie,
Yes.
Neitzer,
Yes.
Selberg,
Yes.
Sale,
Yes.
Starr,
Yes.
Brecky,
Yes.
Erickson.
Yes.
All right, that passes 8-0. Next item, please.
Item 17 is a notice of transfer of appropriations on the memorandum dated October 30, 2020.
All right, move to new business. Any new business from the council tonight? All right, look for a motion to adjourn us.
So moved, Jack.
Second, Brecky.
All right, motion by Jensen, seconded by Selberg to adjourn us. All those in favor say yes.
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 All those opposed? All right, we are adjourned. Have a good night, everyone. Be safe.